on Finance and joint with General Welfare. At this time, please silence all electronics and do not approach the dais. I repeat, please do not approach the dais. Thank you for your cooperation. Chairs, you may begin.
Thank you, Sergeant. All right, good morning. Welcome to day 5 of FY26 executive budget hearings. I'm Councilmember Justin Brannan. I chair the Committee on Finance, and this morning I'm pleased to be joined by my good friend and co-chair Deputy Speaker Ayala. She chairs the Committee on General Welfare. We've been joined this morning by Council members Salam, Carr, and Caban on Zoom. Welcome, Commissioner Park and your team. Thank you for joining us today to answer our questions. Just as a reminder, this is a government proceeding and decorum shall be observed at all times. As such, members of the public must remain silent at all times. We will be taking public testimony on DHS and HRA's FY26 executive budget later today after DHS and HRA testify. If you wish to speak on these budget items, please make sure you fill out a witness slip with the Sergeant at Arms in the back. In February, the House of Representatives passed sweeping cuts to Medicaid and Supplemental Nutrition Assistance Programs, or SNAP, which entailed over $1 trillion. It's important to note that almost $1.9 billion, or about 14.4% of HRA's existing total budget, is federal funding in support of safety net programs such as SNAP, cash assistance, and Medicaid. In March, my colleagues and I questioned the administration on how they plan to address the serious threat posed by the Trump administration regarding illegally seized and unprecedented federal funding cuts to DSS programming. The financial instability remains a risk to crucial programs for some of our most vulnerable New Yorkers, including housing, food assistance, and health care. It remains imperative that the city's plan is ironclad to ensure vital and critical services are afforded to the New Yorkers who rely on them. On May 1st, the administration released their executive plan for FY26 to 29 with a proposed FY26 budget of $115.1 billion. HRA's proposed FY26 budget of $11.74 billion represents 10.2% of the administration's proposed FY26 budget in the executive plan. This is an increase of $271.1 million, or 2.4% from the $11.47 billion, which was originally budgeted in the preliminary plan back in January. This increase results from several actions, mostly additional funding to support the department's rental assistance programs, increased costs of cash assistance, emergency food sources, baseline funding for pregnant people applying for shelter with rental assistance, and anti-harassment funding for residents. All very, very crucial, critical, important programs. As of March 2025, HRA had just over 1,300 vacancies relative to their FY26 budgeted headcount. DHS proposed FY26 budget of $3.4 billion represents 3% of the administration's budget in the FY26 executive plan. It represents a decrease of $130.9 million, or 3.7%, from the $3.58 billion budgeted in the preliminary plan back in January. As of March 2025, DHS had 76 vacancies relative to their FY25 budgeted headcount. Today, my co-chair and our colleagues will be seeking answers to many questions. My questioning will mostly dive into the onslaught of federal funding cuts, the increase in assistance demonstrated by everyday New Yorkers, the community food connection, and city vendor contracting. While the administration baselined the prevailing wage for shelter security, there was no commitment to increasing the sought-after non-asylum seeker shelter, and we did not see it increase on our human service provider contract rates to ensure that those doing the very important work are adequately paid. I'm now going to turn it over to my co-chair for this hearing, Deputy Speaker Ayala, for her opening statement.
He forgot to say his favorite co-chair, but it's okay. I'm just saying. Good morning, everyone. I am Deputy Speaker Diana Ayala, Chair of the General Welfare Committee. Thank you for joining me for the fiscal year 2026 executive budget hearing for the General Welfare Committee, held jointly with the Finance Committee. The city's proposed fiscal 2026 executive budget totals $115.1 billion, of which $15.2 billion, or 13.2%, funds the Department of Social Services, encompassing the Human Services Administration and the Department of Homeless Services. DSS serves the most vulnerable populations in the city, sheltering the homeless and improving the economic well-being of those facing poverty. These services are more vital now than ever, given the record high shelter census and the economic challenges faced by low-income New York City residents. The council's budget response made it clear that protecting housing opportunities, bolstering the social safety net, and serving the most vulnerable residents are some of the council's top priorities. I was glad to see that the administration added funding in fiscal year 26 to current spending levels for HASA housing, the Community Food Connection, and Fair Fares. Additionally, I was pleased that the administration added funding for human service provider COLAs and baselined the prevailing wage for security at homeless shelters. However, I am also disappointed to see that the executive plan did not add funding for crucial council priorities that were laid out in the budget response, including to increase the baseline cash assistance, city FEPs, and non-asylum shelters to align with recent actual spending, to expand fair fares to individuals making up to 200% of the federal poverty level, to expand and baseline funding for the Community Food Connection, to increase staffing and upgrade systems to improve client services and benefit administration, or to adequately fund the Right to Counsel program so that all eligible individuals can receive legal assistance. I continue to be concerned that the city is not investing enough in long-term solutions to address poverty and prevent homelessness. The city's shelter census, which continues to rise, is both an expensive burden on the city and difficult experience for families and individuals. The city should prioritize programs to assist clients in finding and maintaining permanent housing in their communities. The budget for the City FEPS program drops from $1.27 billion this fiscal year to less than half of that in fiscal year 2026 and in the outer years. At a time of record high demand and with federal funding at risk for programs such as Section 8, we cannot abandon thousands of families who rely on City FEPS to maintain housing and avoid entering shelters. I would like to thank the General Welfare Committee for their work in putting this hearing together today. Faria Rahman, Finance Analyst, Elizabeth Scheiders Garcia, Finance Analyst, Julia Haramis, Unit Head, Pernina Rosenberg, Policy Analyst, Sahar Mozami, Senior Counsel, and I would also like to thank my Chief of Staff, Elsie Encarnacion, and Stephanie Ejera. And now, Commissioner Park, our counsel will swear you in.
I also want to just take a quick second to thank the entire Council Finance Division for all their work during this first week of 3 weeks of hearings, especially, again, Julia Haramis, Faria Rahman, Elizabeth Childers Garcia, and my committee counsel, Brian Sarfo, who will now swear you in, and we can begin. Thank you.
Good morning. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions? Commissioner Park?
I do.
Deputy Commissioner Barry?
I do.
Officer Johns?
I do.
Admin Carter?
I do.
Admin French?
I do.
You may begin.
Thank you. Good morning. I want to thank Deputy Speaker Ayala and the members of the General Welfare Committee, as well as Chair Brannon and the members of the Finance Committee for holding today's hearing and for the opportunity to testify about the Department of Social Services, DSS's fiscal year 2026 executive budget. My name is Molly Wasso Park. I'm the Commissioner of the New York City Department of Social Services. I am wearing a navy blue suit. I have short brown curly hair. DSS is made up of both the Human Resources Administration, HRA, and the Department of Homeless Services, DHS. So accordingly, I'm also joined by my colleagues, DHS Administrator Jocelyn Carter and HRA Administrator Scott French, as well as DSS First Deputy Commissioner Jill Barry and DSS Chief Program, Performance, and Financial Management Officer Richard Johns. Collectively, we represent the approximately 14,000 hardworking staff who dedicate their lives to supporting New Yorkers living at or below the poverty line. All right, we're there. This next slide outlines the agenda for the presentation. Today, we will provide an overview of the FY26 executive budgets for both agencies and highlight the programs and services supported by these resources. Next slide. This slide presents 3 concentric circles in green, dark blue, and light blue, representing the 3 agencies. DSS is the largest municipal social services agency in the country, comprised of the Human Resources Administration, HRA, and the Department of Homeless Services, DHS. Under the consolidated management structure and the shared mission of DSS, HRA and DHS provide a seamless and integrated continuum of client services to millions of New Yorkers every day. Across the agencies, our primary goal is to create a path to sustainability for low-income New Yorkers through 3 pillars. 1, streamlining access to social services. 2, addressing homelessness and housing instability. And 3, creating economic stability. We will refer back to these 3 pillars throughout our presentation. Next slide. This slide shows an image of the Manhattan skyline and presents the title of the next portion of our presentation, Agency Budgets. I'm now going to pivot to giving an overview of the DSS, HRA, and DHS FY26 executive budgets. Next. Okay. This slide shows a pie chart highlighting the different portions of the DSS HRA budget. DSS HRA is dedicated to fighting poverty and income inequality, providing essential benefits including cash assistance, nutrition and food programs, public health insurance, employment and transportation services, and access to housing, homelessness prevention, and emergency assistance. DSS HRA helps more than 3 million New Yorkers annually through the administration of more than 15 major public benefit programs, with a budgeted headcount of approximately 12,000. The FY25 budget for DSS HRA is $13.4 billion, including $10.5 billion in city funds. The majority, over 80%, of the HRA city tax levy budget is earmarked for benefits that the city administers on behalf of New York State. And almost 97% of the DSS HRA city-funded budget provides direct benefits and support to New Yorkers. The blue portion of this pie graph is Medicaid. That includes home care, managed care, mental health, substance use services, and hospital care. Is administered by New York State. The city pays a portion of the Medicaid costs out of the city tax levy. That is the 60% of the DSS HRA city-funded budget shown here. HRA sends these funds directly to New York State, and the state uses it along with state and federal funds it controls to pay medical providers and managed care plans. 16% of the DSS HRA budget goes to public assistance. That is the red portion of the pie graph. You should note that cash assistance benefit levels and eligibility rules are set by state law and regulation, although they are administered at the city level. Homeless prevention and rental assistance is the green portion of the pie chart. There is 3% of the budget is used for administration, which is purple, 2% for legal services in orange, 2% for HASA, and 1% each for employment services, community food connection, and domestic violence services. HRA also administers SNAP for 1.8 million clients. These benefits, which are federally funded at about $5 billion a year, don't flow through our budget, so they're not shown here, but they represent another critical benefit that HRA is mandated to provide. Last thing that I'd like to note on the DSS budget is that the administration section covers shares services for both HRA and DHS. Next slide. So this next slide shows a pie chart highlighting the different portions of the DHS budget. DHS is committed to providing safe temporary shelter, connecting New Yorkers experiencing homelessness to permanent housing and addressing unsheltered homelessness. DHS has an FY25 budget of $4.4 billion, of which $2.4 billion is city tax levy. The agency has a headcount of 1,995, and with its not-for-profit partners, is the largest municipal organization dedicated to addressing homelessness in the United States. Almost 97% of the DHS budget supports shelter for families and individuals and services for the unsheltered, including outreach and low-barrier beds. The DHS budget is broken out as follows in FY25. $1.35 billion for family shelter, that's the purple section, $1.34 billion for adult shelter in green, $384 million for street outreach in red, and the remaining 3%, which is blue section, is administrative services. Next slide. This next slide shows a chart highlighting key programs and services across the two agencies that were increased in the FY26 financial plan. In the FY26 financial plan, DSS is continuing to make significant investments in our critical programs, totaling $323.5 million in new needs. This includes HIV/AIDS services, HASA, Affordable Housing Services, or AHS, domestic violence services, fair fares, New York City benefits, senior affordable rental apartments, the SARA program, street outreach and end-of-line services, community food connection, and Wi-Fi access at DHS shelters. Next slide. This slide shows an image of the Manhattan skyline and presents the title of the next portion of our presentation, Federal Budget Impact on DSS. As I have already highlighted in my testimony, DSS, HRA, and DHS budgets are significantly reliant on federal dollars. But more importantly, the 3 million people we serve receive significant benefits directly from the federal government. We are seeing increasing demand for these services at the same time that they are at threat. The current congressional reconciliation proposal contemplates cuts which they deem necessary to reach their goal of extending $2 trillion tax cuts for the most affluent Americans. Key to reaching that $2 trillion goal are targeted cuts to the Agriculture and Energy and Commerce committees, which oversee SNAP and Medicaid, respectively. Earlier this week, the House Agricultural Committee released their markup bill, which proposes cutting $300 billion in SNAP funding over 10 years. 1.8 million New Yorkers rely on SNAP to feed their families. That includes approximately a third of whom are older adults and a third who are children. The House Energy and Commerce Committee markup was also released, which targets $715 billion in Medicaid cuts through a variety of amendments to eligibility. And there are 4 million New York City residents who rely on Medicaid for health care. In both programs, Congress envisions work requirements and shifting costs to the states, among other changes. In addition to the reconciliation plan, the White House released their skinny budget proposal at the beginning of the month. Although the $163 billion in proposed cuts is silent on SNAP, Medicaid, and TANF, it would be equally devastating to low-income New Yorkers. For example, the skinny budget proposes $28 billion cuts to housing and community development programs, impacting public housing and Section 8 rental subsidies specifically. Tens of thousands of New York households rely on affordable housing subsidies to survive in our high-cost city. The skinny budget also proposes eliminating the Community Development Block Grant, which supports housing maintenance and planning, and a 12% reduction to continuum of care and housing opportunities for people with AIDS. It proposes eliminating Low-Income Home Energy Assistance Program, LIHEAP, which is a $4 billion cut nationally, which thousands of New Yorkers rely on for heating and cooling in their homes. All of these cuts impact vital programs that the city and state do not have the budget capacity to replace. We encourage all impacted New Yorkers to make your voices heard, because if any of these cuts come to fruition, it would be catastrophic for New Yorkers, not only for low-income households, but for the overall economy of the city and the region. Next slide. This slide shows an image of the Manhattan skyline and presents the title of the next portion of our presentation, Streamlining Access to Social Services. I'm now going to turn to highlighting some of the results of our streamlining access to social services and benefits work. Next slide. This slide shows a linear graph highlighting SNAP recipients in blue and applications in green. As you can see, the SNAP caseload continues to remain high, with almost 1.8 million recipients and over 30,000 applications each month as of April 2025. Because of our investment in Access HRA and the ability of clients to apply, recertify, and interview online and on the phone, we are able to manage the high caseload and ensure clients have access to these important benefits. Next slide. This slide shows a linear graph highlighting cash assistance recipients in blue and applications in green. Turning to cash assistance in the executive budget, the FY25 budget for cash assistance is $2.65 billion to support a caseload of 596,000 recipients through June 2025. That includes $78 million that was added in the executive budget for FY25 and $92 million that was added in the November plan for FY25. I should note that this graph shows both one-time and recurring recipients. In April, there were over 588,000 ongoing recipients and 7,400 one-time recipients. Although the one-time recipients receive rent and utility arrears along with other benefits, it is important to note that many of our clients receiving ongoing assistance also periodically receive emergency payments for rent arrears so they can remain stably housed. In FY24, HRA issued emergency rent payments to over 56,000 households. Next slide. Along with SNAP and cash assistance, DSS HRA continues to support New Yorkers with other key benefits, including, but certainly not limited to, Medicaid, fair fares, and HEAP. I cannot stress enough that the automatic Medicaid extensions have ended. Clients must recertify in order to keep their health insurance. This is a federal mandate and not something that we have any flexibility on. We are working to ensure that everyone who remains eligible for Medicaid receives ongoing benefits, and we have a robust outreach campaign to remind Medicaid clients of changes to renewal rules and the urgency of submitting renewal applications to avoid any interruptions to coverage. Please continue to remind all your eligible constituents to renew. On another note, in collaboration with the Council, we have expanded fair fares eligibility to 145% of the federal poverty level and encourage eligible New Yorkers to submit for benefits as soon as possible. And although, as I noted, the federal skinny budget contemplates eliminating HEAP, DSS continues to collaborate with the state to provide heating and cooling benefits to New Yorkers. Next slide. Slide shows an image of the Manhattan skyline and presents the title of the next portion of our presentation, Addressing Homelessness and Housing Instability. Keeping New Yorkers in their homes, moving families and individuals out of shelter, and helping these households remain stably housed are all primary goals for the agency, and I now want to talk about our progress in these areas. Next slide. This slide shows a pie chart highlighting the breakdown of the DHS client population. As of May 2nd, the overall DHS census was 85,615 people, an increase of 42,000 people since the beginning of 2022, before the surge in the special population asylum seekers to New York City. Of the 85,000, approximately 59,000 people, almost 70%, are families made up of children, 31,741 people in that sort of fuchsia section there, and their adult parents and caregivers, 27,453 people in light blue. In other words, children make up 37%, or more than a third, of all people in the shelter system. The remaining population is made up of single adult men, just over 16,000 in dark blue, single adult women, about 5,700 in orange, and adult families, about 4,600 in green. And 75% of more than 75% of the new arrival population, the asylum seekers, are currently housed in the DHS shelter system. Next slide. In New York City, 97% of people experiencing homelessness are sheltered, but that 3% of people experiencing homelessness who are on the streets or subways is an area of particular focus for the agency. Since the start of this administration, DSS-DHS has aggressively expanded low-barrier bed capacity. These are shelter models that are targeted to those experiencing unsheltered homelessness, also known as safe havens and stabilization beds. At this year's State of the City announcement, Mayor Adams announced 900 new low-barrier beds, representing an investment of another $106 million in efforts to address street homelessness in New York City. These beds will start to come online as early as this summer, and the remaining beds to be identified in the DHS development pipeline and brought online in subsequent years. DHS's safe haven and stabilization bed total will be 4,900 once all is said and done. Because of this investment in street homeless solutions, DHS placed more than 3,000 New Yorkers residing in low-barrier programs to permanent housing during the Adams administration thus far. And since the launch of the Subway Safety Plan in February 2022, more than 8,500 New Yorkers have been connected to shelter. DSS-DHS continues to invest in outreach staffing to support referrals to low-barrier shelter. Lastly, under the Adams administration, DHS also opened 3 new drop-in centers to offer clients additional access to services. Next slide. DSS remains committed to connecting New Yorkers to permanent housing and keeping them stably housed. This slide outlines the strides we have made over the past year by strengthening our rental assistance programs, providing homelessness prevention services, and leveraging social service dollars to actually create more affordable housing. As a result of this work, DSS has seen record-breaking increases in the number of permanent housing placements. in calendar year 24, more than 10,200 households moved out of shelter into permanent housing placements using city FEPS. That's a 56% increase compared to calendar year 23. And this number of city FEPS vouchers is only a subset of the nearly 15,000 households comprised of more than 31,000 New Yorkers who were able to obtain permanent housing or stay in their homes using city FEPS voucher, reflecting a 43% increase year over year. Through our home-based homelessness prevention services in calendar year 24, more than 19,000 households, or about 40,000 New Yorkers, remained in their homes, and more than 11,000 households, or about 33,000 New Yorkers, received aftercare services from home-based to help them stay stably housed. And the Affordable Housing Services Program, AHS, which is set to create at least 1,000 affordable housing units for city FEPS voucher holders exiting, and this program remains a significant priority for the agency. Through AHS, we use social service dollars to help not-for-profit human service providers either finance the purchase of or long-term lease of buildings for use as affordable housing. In other words, we are actually able to use social service dollars to add to the affordable housing stock. We are proud of the progress we've made so far. DSS has already opened more than 450 apartments across 6 high-quality affordable housing sites in the Bronx and Brooklyn in partnership with not-for-profit providers, and over 500 units are in the pipeline. Next slide. I now want to take a moment to highlight some of the details on the recent proposed rule change impacting the city FEPS program. I understand the concerns that this proposed rule change has raised, and I want to take a moment to really address this head on. Since its inception in 2018, City FEPS has grown to become the second largest rental subsidy program in the nation, behind only NYCHA's Section 8 program. As a result, the budget for the program has ballooned from $250 million in 2021 to $1.2 billion this year. So in other words, that is a 5-fold increase in spending in the space of 4 years. With the threat of federal cuts to other housing subsidy programs losing, DSS, in coordination with OMB, has strategically pursued a variety of measures to manage the cost of the city FEPS program, including this proposed rule change. So what the rule change does is for those renewing at year 6, so people who have received after the 5-year standard term of the voucher, and who have employment income, DSS is proposing to change the baseline household contribution from 30% of the household's monthly income to 40% of households' monthly income. This is one of only several changes that DSS is making to the program to address the significant growth in costs and ensure the program is sustainable going forward. Some other examples, along with HPD, we have scaled back the augmented city FEPS program where the voucher can be used in higher rent units. And we are implementing rent reasonableness to make sure landlords are not overcharging us for units. Just speaking personally, City FEPS is a absolutely critical program. It is something that investing in the program and growing it has been really a hallmark of my tenure as commissioner. But I also think it is really important that we are thinking about responsible financial management so that City FEPS can continue to serve as a lifeline going forward. It is really, I think, one of the most important things that I can do as commissioner to make sure that City FEPS remains a strong program, and that does mean making some changes so that we can bend the cost curve. Next slide. Pivoting to another aspect of the rule change that was recently released, and as we discussed at our preliminary budget hearing and at the Mayor's State of the City, DSS is pursuing a pilot program to work to reduce the number of babies born in shelter. Our CRIB program, CRIB stands for Creating Real Impact at Birth pilot program, is included in the rule change for City FEPS that was recently released. The necessary rule change was published at the end of April, and we are on track to launch CRIB over the summer. Next slide. This slide shows an image of the Manhattan skyline and presents the title of the next portion of our presentation, Creating Economic Stability. So moving to the third pillar of our programs, Creating Economic Stability. We recognize that more and more New Yorkers rely on our city's resources to make ends meet. In addition to public benefits, rental assistance, and other essential resources we offer to help people get back on their feet, I will provide an overview of our career services and other supports that enable New Yorkers to secure steady income and live sustainable lives. Next slide. In calendar year 2024, HRA helped 15,577 clients secure employment, which I am thrilled to say is an 89% increase over the calendar year 2023 number of 8,252 job placements. In FY24, Hire NYC broke their record with human service providers hiring 8,197 public assistance clients. And in FY25, 6,418 clients have been hired so far, putting us on track to exceed last year's number, which was itself record-breaking. The Pathways to Industrial and Construction Careers program, PINC, advances training and education and job placements in industrial and construction jobs. We've enrolled 1,126 individuals thus far, with 653 completions of training programs. We've referred just over 1,000 individuals to jobs. 513 have received job offers and 383 job placements, with more than 8 unions and public and private employers, and those numbers continue to go up every day. This is an initiative we're very excited about. Next slide. Going forward, we will continue to invest in our career services programming. The Pathways for Access to Careers and Employment, or PACE contracts, begin October 2025 using the centralized, quote, no wrong door program model with locations throughout the boroughs. This program will streamline and minimize travel burdens for clients, maximize access to all employment and support services, and foster stronger client and staff relationships. Establish an in-demand occupation and sector-focused approach that connects clients to skilled professions that offer family-sustaining wages. Utilize labor market data to assist clients in gaining marketable skills for success and advancement in their careers. And streamline processes for vendors by offering a hybrid approach to engaging clients. Next slide. I will close by underlining our ongoing commitment to break down government silos and improve access to services. The challenges DSS, HRA, DHS works to confront bridge across agencies and further bridge across jurisdictional boundaries. Overcoming these challenges goes to the heart of creating the kind of caring, compassionate communities that we seek to live in. We appreciate the opportunity to testify today, and we welcome any questions that you may have. Thank you.
Thank you, Commissioner. We've also been joined by Council Members Ressler, Lewis, Ung, Aviles, Stevens, and Banks. I want to dive right in because we've got a lot of questions today. Since both the executive and legislative branches of the federal government came under Republican control in January, we've seen a massive effort to defund social services, which poses a major threat to both DHS and HRA. Most of HRA's federal funding goes to safety net support, including cash assistance, domestic violence shelters, SNAP administration, child support, employment programs, energy assistance, and Medicaid. So what concerns, talk a little bit about the grave concerns DSS has regarding funding for specific DHS and HRA programs, given the federal climate and the lack of a plan from the administration.
I am incredibly concerned about what we are seeing at the federal level, and I think that plays out on 2 levels. One is cuts to the benefits themselves that flow directly to clients, and 2, on the impact of the agencies. So the social service programs that that we are monitoring most closely at the city level are SNAP and Medicaid. Sorry, I should say at the DSS level are SNAP and Medicaid. Those are certainly not the only initiatives and programs that I'm concerned about. There are very substantial cuts to federal housing programs that, while not directly tied into the DSS budget, absolutely serve the clients that we are that we also serve, and that we are certainly looking at a prospect of significant upticks in homelessness, for example, if some of this comes to pass. I think, as I mentioned in my testimony, we're seeing these sort of 2 primary strategies from the federal level. One is increased work requirements, and 2 is pushing costs down to the state. As we talked about in our testimony, DSS really does believe in workforce development and helping low-income households access economic opportunity. But that is to do that responsibly and to do it in a way that actually is successful in helping people grow economically takes a lot of thought and a lot of resources and really involves putting significant supports around low-income people. So, ask you all to put yourselves in the shoes of a single parent without a high school diploma with an 8-year-old who under the congressional plan would now have to work for SNAP benefits, right? What job is out there, right? How does that person actually successfully get to employment? And just there are tools that we have. As I mentioned in the testimony, we have very robust and very successful career support programs that are based around the work requirements that already exist for cash assistance. By way of context, we spend about $51 million a year on our career services programs for cash assistance. The House has proposed $100 million nationally to implement work requirements for Medicaid, right? So in order to actually have a serious conversation about what low-income households need to grow economically, we are in the wrong order of magnitude when we're talking about work requirements. So setting aside the moral aspects of looking for people to work for basic supports like food and healthcare, we don't have the infrastructure, and Congress is not contemplating the infrastructure to make this a realistic option. So this is something that we're incredibly concerned about. And then, as costs are pushed down to the state, we would expect that to get pushed down to the local level as well. We don't have any of the details, obviously. It is, so it's premature for me to talk about numbers, but I think we can expect that to happen.
Have you received any notification from state or federal to prepare for cuts or eliminations?
We absolutely are taking those steps, and I think we are approaching this in a twofold way. One is engaging with all the stakeholders that we possibly can to educate and engage about how critical these benefits are. So that means elected officials at all levels of government. It means our not-for-profit providers. We met with our impacted advocates group, with essentially anybody who will listen to me. Philanthropy, right? We are making sure we're getting materials out about what the impact is, talking not only about impact to low-income households, but income to the economy as a whole, right? Every dollar of SNAP spent in New York City is $1.54 worth of economic activity, right? Nobody saves their SNAP benefits. This is money that goes to support our communities. So above and beyond what it means to be for low-income households, these cuts also have the potential to be devastating for our economy. So we are absolutely engaged in that kind of outreach and education. The other thing that we are doing internally is contingency planning. What could we do differently, and what would we do less of if faced with these cuts? I'm not going to go into specifics here, both because we're still in the planning process, but more importantly because I don't want to give a roadmap for how cuts could be taken. But what I will say is there are very few good options given the magnitude that we're talking about. There are some very grim choices in front of us.
Okay, I want to talk a bit about under-budgeting. In the past several years, DSS has under-budgeted major entitlement programs funded through DHS and HRA. So there's often been a considerable misalignment between adopted budgets and actual year-end expenditures. Programs like cash assistance, city FEPS, the non-asylum seeker shelter cost, and HASA housing have been historically under-budgeted at adoption, with increments of funding added throughout the fiscal year. So in the current fiscal year, the budgeted amounts for all these programs have seen dramatic increases between the adopted and the following executive plan. So can you explain how DSS projects the level of need for these programs, and how are actual expenditures for the prior fiscal year factored into this analysis and budgeting practices?
Thank you, Councilmember. So let me start by saying that the FY26 budget was very helpful in addressing some of the ongoing challenges and some of those initiatives that you mentioned. So in exec, we addressed the HASA budget, we addressed Community Food Connection, filled in sort of a number of the things that have traditionally been adoption ads. And so I'm very pleased that that the administration was able to do that at exec. Overall, it was a very good budget for us. There are, as you note, significant issues to resolve with both shelter, cash assistance and rental assistance. Those are large programs that are challenging to project because utilization can vary, costs of services can vary, and we work very closely with OMB to adjust funding on an as-needed basis.
So will DSS be increasing the baseline budget for FY26?
We are certainly working closely with our partners at OMB to manage the budget for those three critical programs.
Has under-budgeting ever impacted the agency's ability to administer these vital support programs?
There are very occasionally some short-term glitches in cash flow, but these are very short-lived, and we work closely to OMB to manage that.
And is there discussion around reforming DSS to reform their projection techniques to more accurately reflect?
We work very closely with OMB to make sure that the budget is as needed.
Okay. I want to ask some questions about Local Law 125. Local Law 125, those of you that don't know, the Safety in Our Shelters Act, it required the provision of prevailing wage and supplemental benefits to security officers and fire guards at city contracted shelters beginning back in May of 22. Do all current DHS contracts with shelter providers or security subcontractors reflect the local law prevailing wage requirement?
So let me start by saying I'm thrilled that this year the prevailing wage increment was baselined in the budget, so that will be very helpful for us going forward. I believe the contract language for every single contract does have that prevailing wage requirement in it at this point, but we will double check and confirm that.
So how long did it take DHS to amend all of its shelter contracts to account for the requirements of Local Law 125?
I don't know off the top of my head, but we can circle back.
I guess there's a concern around, given the time it took to implement 125 by way of these contract changes, security officers and fire guards covered by the prevailing wage requirement were owed retroactive wages and benefits. Has DHS provided any guidance since implementation?
We engage very closely with our providers to make sure that they have all of the information that we have. As you note, we did have to make adjustments on a year-by-year basis. We did have to amend all of the contracts. That's something we worked very closely with our providers. And the fact that we now have the funding baselined, I think will make this more streamlined going forward.
Okay, because we've heard from stakeholders who have communicated to us that they've been unable to obtain clarity from DHS as to the total amount of back pay which was owed and may still be owed to these workers.
Okay. Be more than happy to follow up offline to get the name of those stakeholders, and we will follow up.
Okay, and can you tell us the amount of retroactive wages and supplemental benefits that are still owed to these workers?
I don't have that with me, but we can follow up.
Okay, I'd appreciate that information like ASAP.
Of course.
And then, so going forward, what steps will the agency take to ensure that these workers receive their retroactive wages?
So every contract goes through a closeout process. That happens at the end of the fiscal year. We're obviously approaching the end of the fiscal year, so that is a natural moment that we can use to make sure that we have done that reconciliation. Administrator Carter, anything you'd like to add?
Sure, Commissioner. One of the things that we've been doing with every provider is looking at the individually to see where they are in their process. So we would look at what has been happening, and if we needed to really implement and put whatever is needed in the budget, we will be doing that at closeout too.
Do you have an idea of how many workers are in this bucket?
We'll have to come back to you with that.
All right, we got a lot of homework to do. I want to ask two more things. I'm going to turn it over to the Deputy Speaker. The executive plan includes an additional $27.4 million in HEAP, the Federal Home Energy Assistance Program. but it's FY25 only. So how is that amount determined, the 27.4 million?
I'm sorry, you're speaking about HEAP?
Yeah. Executive plan includes 27.4 million for HEAP, but it's for FY25 only.
So with all of our grant funds, we typically mod them in as the year goes by so that we are adjusting to know what we are getting from the state and how we are claiming. Chief Johnson, anything you want to add there?
Yeah, the only thing I would add is that the funding was added when the state reopened the application process.
I want to ask about that too. So it was reported, I guess, in the press that back in January, I think, the city received notice from the state that the HEAP program was closing applications 2 months ahead of schedule. After that initial panic, Governor Hochul's office announced that the state would reallocate $35 million from an unspecified source to allow these programs to remain open. Do we know why this premature closure happened?
So HEAP funds are federally funded. There's a fixed dollar amount, and the way that the program has traditionally been run by the state is they take applications, and at the point at which they run out of money, they will close the door. Applications statewide, this is not a New York City specific issue, applications statewide were running higher than anticipated, which is why they shut the program door very suddenly, given that it was in the peak of winter and that there were very serious ramifications. We're pleased that the state was able to find additional financing, but I think it really reflects the critical nature of the program and the concern that we have with the president's proposal to eliminate it.
But from what you know, when they announced in January that they were suddenly shutting this down 2 weeks early or 2 months early, was it because they got a call from Washington saying the money's not coming, or was it something else?
Because they had run out of the current year allocations.
I see, okay.
So they added state funding.
Got it, okay. Last from me, I just want to talk about the subway safety plan. February 18, 2022, the mayor released the subway safety plan outlining the city's strategy to address street homelessness and public safety on public transit. It was first announced and funded in the FY23 executive plan with 171.3 million, which was baselined. It's a considerable amount of additional funding has also been added to DHS's budget since the announcement back in 22. So how is DHS measuring or quantifying the success or the progress of the subway safety plan?
So there's 3 primary metrics that we look at to track how we're doing on unsheltered homelessness engagement. One is the number of touch points that we have with clients, and by we, I'm including both DHS providers and our contracted outreach providers. 2 is the number of placements that we make into transitional housing. That might be shelter, it could be the low barrier beds like safe havens. And 3 is permanent housing placements. I will say that the permanent housing side of things is relatively new to the focus for this world. We used to declare victory when we got somebody off of the streets and into shelter, but shelter isn't the goal for anybody. We want to get them to permanent housing, so that has become an important part of our metric. Given the nature of unsheltered homelessness, which is really, we at DHS have a mandate and a mission to engage with those experiencing unsheltered homelessness, but very limited ability to prevent it. We have to be looking at the volume of services that we are providing and the number of people that we are getting off the streets, but also recognizing that this is a multi-level problem. So just to make this really concrete, last year, for example, we placed about 1,200 people who living in low barrier beds and safe havens and stabilization beds into permanent housing. Almost exactly the same number of people were discharged from upstate psychiatric hospitals to DHS. So as much as I would like to say the metric should be exactly the number of people who are experiencing unsheltered homelessness, I think in terms of what we can actually control, it is the level of our engagement and the number of people for whom we are solving the issue. And then we need to continue to work with other agencies and other levels of government to make sure that we are addressing the upstream issue. Administrator Carter, anything you'd like to add?
Commissioner, I think you really have touched on it. I mean, I think one of the things that we've been looking at is how do we prevent feeder systems into unsheltered homelessness. So we've been really trying to work comprehensively and collaboratively with those specific agencies. So we're doing some work around that, as well as doing real meetings with our other city partners and state partners, really in looking at, are we doing weekly meetings? Are we out doing engagements? What is the work that needs to be done above and below ground with those who are unsheltered? So we're doing that work.
And as you know, I represent two end-of-line stations, Stillwell Avenue and 95th Street in Bay Ridge and Coney Island. What is the budget for outreach at end-of-line stations for FY25 and 26?
So I don't know that we have a budget specifically for end of line. Total budget for all of our street budget programs for FY25 is $380 million. Of that, 73 million is for the outreach contracts, and then there's another 20 or so million for DHS staff. The remainder of it is largely for real estate for the safe havens, stabilization beds, and drop-in centers.
What does that total? What does that tally to?
380 million is the FY25 budget.
And how many people did we, through the subway safety plan, how many people did we get off the subway into housing or into shelter last year?
Hold on, Councilmember, let me pull that.
Okay.
Jump in if you get it first.
Okay. I'm going to go to Tiffany next.
Sorry. So FY24, in terms of for referrals to services, it was 13,578. I do not have the actual. And in terms of shelter placements, it was 3,614.
So the 13,578, what do we call that? Those are folks that we touched, folks we referred, what?
Referrals, yeah.
Okay. And what was the placement number again?
3,614. And I want to maybe take a step back here and really put unsheltered homelessness in New York City in context. I touched on this in my testimony, right? But 97% of people experiencing homelessness in New York City are sheltered. There are too many people on the streets and the subways, and it is something that we are thinking about constantly. But because of the nature of the right to shelter, because of the fact that we do have a very robust shelter system, the people who are on the streets and subways, they've been failed by everybody, right? And they've not just government, but really sort of every level of society. And so building a connection, getting them to come inside is something that sometimes takes a very long time. So that's why the number of referrals, that number of engagements is so much higher than the number of people who came inside. But we do not take a one and done approach to outreach. We're going to keep working with people and figuring out what it is that will connect. One of the things that is important and why we're so excited about the State of the City commitment to increase the number of low barrier beds is that we know that this is a model that's been really successful with the population. The amount of time that people will stay inside as opposed to cycling back to the streets and subways is longer, and success rates for placement to permanent housing are very strong. So we think increasing this housing this shelter model and making sure that those buildings are sited near areas where there are higher concentrations of people experiencing unsheltered homelessness is going to be really critical to continuing to make a dent on this issue.
Okay, thank you, Commissioner. I'm going to turn it now to Councilmember Caban, who is on Zoom, since we have quorum.
Can you hear me? Thank you so much, Chair.
Yes.
Thank you to the administration for being here. Just bear with, I'm having some slight tech issues. Just give me a moment. Okay, great. I want to ask a little bit about involuntary commitment. So the enacted state budget includes resolutions which weaken the legal standard for involuntary commitment, and it's a policy that the mayor has long been a proponent of. And lawmakers and civil rights advocates, they've rallied against this policy, saying that it's too broad and it effectively criminalizes homelessness and mental health issues. I certainly agree with that, but probably even more important than that, if that isn't concerning enough, is that the medical community at large says that this is not best medical practice. So I just have a few questions on this front. I want to know, what role does DHS currently play in involuntary commitment, and how might that change with this new policy?
Sure. I'm going to start, and then I'm going to ask Administrator Carter to chime in. Involuntary removal is never our starting place. We absolutely believe in the value of outreach, the value of building trust, and getting an individual to a place where they are ready to come indoors. That is the mission of DHS, and that is what we work on with our contracted outreach teams every day. That being said, there are emergency situations where that's not going to work. For example, during cold weather, cold code blue nights, I get reports every morning on the number of engagements, and there are very cold nights where we do involuntary removals, because that is literally life-saving for people who are on the street.
I'm sorry, because I have limited time, so I just want to interject here. I'm specifically interested in understanding how your role or your policies and directives might or are changing in light of the state's new legal standard for involuntary commitment, which we know lowers the floor.
So we work very closely with nurses. We have been growing the number of nurses that we have who are going out on outreach, and we really depend on clinical expertise to make a decision on when somebody does need to be taken to the hospital. But Administrator Carter, you want to chime in?
Thanks, Commissioner. It really is important to know that decisions about involuntary removals are done by the licensed clinician, and for us, those are our nurses. That's with the teams that are out. So the decision is not taken lightly. Our licensed nurse is with the team that's making that decision, and they are making that assessment. So for DHS outreach, for provider outreach, it is with the authority of the clinician that's making that determination. It is not done lightly, and it's really looking at what's happening around the circumstance of that particular situation.
I guess my question again, it goes back to that legal standard that was enacted in the state budget, which again lowers the floor. When they're going out, are those clinicians saying, hey, this meets the standard that has now been set by the state? Because then that opens up a larger amount of scenarios, situations where somebody could be involuntarily committed. Like, is that clinician going by the legal standard that's been set? Like, is that what they're told to do, or is it something else? And then I want to add on to that, and I'm going to go ahead and ask all my questions just because I want to be really mindful of my time. I want to know how the expansion of involuntary commitment affects the subway safety plan, and if you guys could just report to us how many involuntary commitments there were in fiscal year 2024 and how many in fiscal year 2025 so far. Because this is my concern, right? With the floor being lowered on involuntary commitments and the gaps in our continuum of care, what we're seeing is we can manufacture more unnecessary involuntary commitments when we aren't investing enough in creating the conditions where people are experiencing acute crisis less often, right? So I'll give you an example. Just in my district 2 days ago, a woman was living in her car and was known to the neighbors, has some mental health issues, but has not been a danger to herself and others. She actually is helpful to the neighbors. She sometimes is able to get some support. And there was a multi-agency response because somebody wanted her car towed for being there over 7 days without moving. And, you know, instead of her being able to access a continuum of care, police officers show up, DHS shows up, a bunch of other people show up, and that's supposed to be the answer. And of course, that agitates her, and then she gets involuntarily committed. Her car gets towed. She's taken to a hospital. She doesn't know where her car is. Doesn't have any money. Doesn't know. Has no place to live. Like, we left her worse off than what she was. But I want to know how the standards and the gaps in the city's continuum of care will contribute to what we're seeing with involuntary commitment. So specifically, can you explain how it's going to affect the subway plan? Can you give me those numbers on how many involuntary commitments there were in 2024 and how many in this fiscal year so far? And then finally, like, how are you going to prevent the overuse of involuntary commitment? Because the reality is that if that gap remains, there will be an overuse, because you're just asking and waiting for people to be in acute crisis when we could be helping people maintain their health.
So, Councilmember, it is not our goal or desire or intent to manufacture anything. We approach all of our outreach with the intent of trying to serve very vulnerable people and get them indoors wherever possible. Given that the language was just released, we have not yet started developing training protocols for that, but we will certainly circle back with the council as we do that. In FY24, there were DHS and our providers did 248 involuntary removals. I don't have the number for year-to-date for FY25, but we can certainly circle back on this. As I mentioned at the beginning, it's a tool that we think should be used very sparingly, but there are instances where somebody is really at risk, and we will continue to approach this from a clinical perspective and trying to serve people to the best of our ability. With respect to the individual that you mentioned, we're happy to follow up offline and figure out the next steps for that individual.
Yeah, I mean, again, the reality is that the policies thus far of this administration in failing to adequately fund and staff up a mental health care continuum does create more instances of acute crisis that rise to the level of people being vulnerable to involuntary commitment. That's my point. Chair, do I have any time? I can't see the clock. I want to be respectful of time.
You're about an hour over.
Okay, thank you. I'll pass it back.
Thank you, council member. Okay, we're going to hand it over now to Deputy Speaker Ayala for her questions.
Good, okay. In our fiscal 2026 budget response, the council called on the administration to align the baseline budget for non-asylum seeker shelter costs with the fiscal year 2025 funding level. At the time, we estimated that would require an additional $537.1 million. The executive plan includes an additional $99.8 million of city funding for fiscal year 25 for those costs, but no additional funding was added for fiscal year 26 or the out years. Why was additional funding needed in fiscal year 25, and how was that funding amount determined?
So projecting shelter costs can be very challenging given the changes in utilization, different trends that we see, the extent to which we're using hotels versus contracted shelters. So we do work very closely with OMB to make essentially real-time changes to the budget as needed. So there were some additional funds needed for FY25, which, as you noted, were added during the executive plan, and we will continue to adjust the budget for FY26, working closely with OMB.
Do you know which population this funding supports?
No, this was general across the board needs.
Okay, why was the funding added for fiscal 25 only in the executive plan? Do you anticipate additional funding will be provided for 26?
We will work closely with OMB to align the budget to as needs appear. As I say, there's some substantial variation in the shelter spending depending on census, and depending, a particular driver of costs is our hotel utilization. We have been able to close some hotels recently, so that may help us with to some degree with managing the budget, but we are in daily contact with OMB and will adjust it as needed.
Okay. As of the executive plan, the budget for non-asylum seeker shelter costs is approximately $2 billion in fiscal year 26 and the out years, which is over $500 million less than the $2.62 billion budgeted in fiscal year 25. Does DHS realistically expect that non-asylum seeker shelter costs will be over $500 million less next fiscal year? And if not, what is the projected cost, and when will additional funding be added to the budget?
Thank you, Councilmember. As I noted, it's something that we really look at, week by week, day by day with OMB, and to the extent that we need to add funds, that is something that we do. We and OMB recognize that shelter is a mandated expense, and we will adjust as we need to going forward.
While the sheltering of asylum seekers has dominated the public conversation over the past couple of years, the city has seen a steady increase in non-asylum seeker shelter census. How much has the non-asylum seeker DHS shelter census increased since the start of fiscal year 25, and how does this vary across populations?
Unless any of my colleagues have that exact number, we may need to get back to you, but I can certainly put some context on the non-asylum shelter census, So at its peak in, I think it was 2019, we were at about 61,000 individuals. And we were able to manage that down somewhat so that before the pandemic started, we were maybe 59, something like that. Much to my surprise, the shelter census plummeted during the pandemic, largely because families with children intake fell very sharply. I will freely admit it is exactly the opposite of what I thought was going to happen. I sort of expected that when people were in a moment of stress and doubled up situations and home 24 hours, that they would come into the shelter system more, but I think the combination of people banding together during an emergency, and even more importantly, the federal income supports that made it financially viable for people to stay in their homes, really dropped intake. So at the start of the administration, the census was about 45,000 people, as I say, really driven by that drop in intake during the pandemic. We have climbed up since then. We are still about 3,000 people below where we were at the start of the pandemic. So at about 56,000, give or take, non-asylum seekers in the DHS system. So it is, yes, it is up, but it is, I think it is some of the increases sort of a resumption to where we were before, as opposed to an increase. We have been very aggressively trying to connect people to subsidized exits. In calendar year 24, we moved about 16,500 people, or households, so more than that on people, from shelter into subsidized exits. That was a 38% increase from where we were the previous year. So we are really, really focused on helping people connect back to permanent housing. But what I think we're also seeing is that there is high need in the community, right? So intake remains strong across all populations. And so because of that, although we have really had these terrific exit numbers, what we've done is slow the rate of growth as opposed to actually reduce the shelter census as much as I would like, but we're not done yet. We're going to keep trying.
Do you keep track of how many people that are coming into the system are coming in because they've been evicted?
Yeah, we do look at reasons for homelessness. The data are better on the families with children side than they are for single adults. The rate, people coming in as a result of formal eviction is relatively low. It's about 10%. That's actually a pre-asylum number because the asylum numbers, sort of inflate the denominator. So right now it's only about 4%. The sort of two primary drivers for shelter entry on the families with children side are domestic violence and relatively what we call discord, and what that typically looks like is relatively young people who have been living with family and a baby or a second baby just adds one too many people to the household. They that puts a lot of strain on them and they enter the shelter system. So, but in many of those cases, the head of household that is coming to the shelter system has never had a lease of their own.
Okay. In the first 2 months of 2025, the non-asylum seeker population in DHS shelters decreased by almost 2,000 to nearly 3.5%. To what do you attribute that rapid decline over such a short period of time? And did these individuals exit to permanent housing?
So I'm not 100% sure exactly what data that you're looking at, and we'd be happy to sit down offline and go through it. But I think a couple of things. One is, as I mentioned, we have been very, very focused on exits. And the first part of this calendar year, we've had terrific exit numbers. We've really been continuing to focus on helping people move out, and we're seeing that in the results of the work that we are doing as a full agency group. The other thing I would say is that there's some seasonal pattern, particularly on families with children intake. It tends to be low in the winter and pick up in the summer, so that may be a piece of what you're seeing as well.
But of the folks that are leaving, do you know what percentage are leaving to permanent housing?
So for, specifically for the non-asylum population you're asking, or in?
Yes.
Yeah. So most overwhelmingly people leave, particularly on the families with children side, people are leaving to permanent housing, and most of those are subsidized exits. On the adult system, there's a little bit more. It's a slightly more complicated dynamic. That's a population that does tend to enter and exit with a little bit more frequency. Administrator Carter, anything you'd like to add?
Thanks, Commissioner. Families with children typically move to permanency with subsidies, like you said. I think the fluidity of a single adult system is because they do a lot more couch surfing, and they come back to us when things kind of go a little bit more downhill. So they are kind of fluid as they come to us. But families do move to permanency using our subsidies.
Okay, and just to clarify, the data is coming from the open data on between January 1st and February 28th.
Okay, we will certainly take a look at that and make sure that I'm confident in the answers that I just gave you, but if there's any nuances that we need to add to that, we'll circle back.
Thank you so much, Commissioner. In March of this year, DHS announced a new pilot program, Enhanced Client Placement Support, which would allow DHS to evict shelter residents who were out of compliance with certain rules. DHS has said that this program is designed to build a culture of accountability. However, many advocates have expressed alarm that the policy would lead to increased street homelessness. What is the budget for this program, and where are the funds allocated in HRA's budget, and in which fiscal years?
I'm going to start. I'm going to pass it over to Administrator Carter. This will be run out of our shelter operations team, and with support from the DSS Office of Legal Affairs. I have headcount numbers. I don't have exact dollars. We can certainly circle back with that. But I'd like Administrator Carter to really talk about the program and how we see it working, because we absolutely do not intend this to increase unsheltered homelessness. We think this is something where we're anticipating very high levels of engagement and control, and if we saw anything like that would be a real issue for us, and we would course correct.
Thanks, Commissioner. One of the things that we were really intentional about is looking at this as client support, right, not sanction. So if we are in the pilot seeing lots of discontinuances, then we're doing something wrong, right? So the idea behind this, when we really thought about this, and I was here in DHS when we had sanction, client responsibility, right? It was really about, clients. And what we have now revamped it is, accountability to, for us, DHS, for the providers, and for clients. So it's a three-prong program, and it's not really, you're not doing something right, clients, right? We want to hold our providers accountable. We want to hold DHS accountable, and certainly the clients accountable, but we want to make sure that our providers are supporting the clients so that they can actually exit shelter to permanency. So that's the goal. The goal is not to put people on the street, right? If I'm seeing that, then we're failing. Right? So right now we're in the training stage. We're not implementing until July, right? Because we want to make sure that we've trained ourselves up. So it is staff that we have hired. So we have a team now at DHS that their staff, a variety of staff, plus our legal partners at DSS, that's really looking at what is the work that needs to happen to support our providers so that they know what do you have to do. We have stages of housing that they should be going through and documenting that this is happening. We are doing lots of work on the ground in our provider spaces that we are seeing, well, how do you really do independent living plans? Are you really doing the work? Because, right, we were saying, clients are not searching, but have we told them, have we showed them? That's the work that we're doing. And so it is moving towards, discontinuous is the last thing I want to see happen. The other piece to it that we want to do is to keep our facilities safe. So there's a gross misconduct piece of it, right? And so we want to reduce gross misconducts, and we want to move the discontinuous. We want to not reduce discontinuous. That's the absolute goal. So if we have done, the training, if we have worked with providers, and they haven't moved towards that, then they're not going to be able to discontinue clients because you haven't done the work, right? So that's the first thing to remember. We're holding everyone accountable in this program. So if they're not doing that, I'm looking at the team saying, well, you're not doing the work too, right? So it's a whole comprehensive program. If we have not done the work, that's one piece. But if we have, and then there's a hole, then we have to plug that hole. We will support providers. We have an Office of Accountability where we'll move providers towards that track to really help tighten what they need to do. If we do get to a discontinuance, there's a first level. There are conferences that will happen. We'll escalate that up. We'll look at, is the apartment really suitable? And suitable means, is the rent, can they really pay that rent? Is there a safety issue? Is it an apartment that they can actually move into because it's not, can you use that apartment? Is it safe, right? So it's not just you're going to do this. So we have a whole process. So we are evaluating throughout the entire year, do we have to tweak anything? So our expectation, we've talked a lot in this program with, and I know the idea that happened years ago, that's not what we want to replicate. So the idea is not sanction, but move to permanency. That's the idea of this program. So ECPS for me is not put people on the street. If that's happening, we have failed. So it's to move people to permanency. That's the goal of the program.
Okay, so what is the actual budget?
The budget numbers?
I'm going to need to circle back with you on that. I know we have headcount numbers.
Okay, and can you also add where the funds are allocated in the budget and for which fiscal years? And include the budget for implementation as well as the analysis of the program, which, Ms. Carter just kind of went through. At the preliminary budget hearing, you testified that in order for a shelter resident to be evicted, there will need to be several instances of gross misconduct. Can you further explain what constitutes gross misconduct and what steps DHS takes to address more minor misconduct before pursuing eviction, which I think we heard a little bit of, but I would love to hear what you consider to be gross misconduct and how many instances is several.
Gross misconduct is a different, levels of gross misconduct is something really egregious, right? That's when we say gross misconduct. It is not, a typical fight. It is something that we consider, and it would be a case by case. But every day we have things that happen that we do conferences. It's not, nothing is, everything is not, we're going to discontinue. Really, the idea is, let's do case conferences, let's course correct, let's make sure that we can help, make a difference to keep our clients in our shelter system. But it's supporting our clients to understand and the providers to understand how we de-escalate situations before they get to a point that we're thinking that we need to discontinue any clients.
But it is your policy, so do you have an example of what you would constitute gross misconduct?
Off the top of my head, what would I think about? It is something that's a violent act. It is something that puts the health and safety of other clients at risk. It is something where we see firearms. That's the type of, when I think gross misconduct, that's what I'm thinking about.
And if I could chime in, right, we track the number of serious incidents in our shelter system and the number of serious violent incidents in the shelter system is going down. But we also know that this is a concern for clients, right? People want and deserve to feel safe in the place where they are receiving emergency shelter. And so we are looking at a broad spectrum of ways that we can improve and strengthen the safety of the shelter system. This is a part of that. It is training for security guards, both DHS peace officers and contracted security guards. It is investing in the kind of trauma-informed care and de-escalation that Administrator Carter mentioned, right? So across the board, it is how do we make sure that somebody who is facing a moment of trauma, who needs emergency shelter, has a safe place to stay. At the end of the day, holding people who are not engaging with us accountable for their actions makes things safer for everybody. But as Administrator Carter noted, there will be multiple instances and points of engagement so that nobody is going to be sanctioned on day one.
And would that look different in a regular shelter with, with general population than it would in a shelter that houses individuals with like serious mental health?
We are not piloting this in mental health shelters.
Okay, I appreciate that. Okay, so we've heard reports from many providers that many of the 19 shelters that are slated to be a part of this pilot are understaffed. One of the shelters is budgeted 6 case managers and 2 housing specialists, but currently has only 1 case manager and no housing specialist. Why is the city targeting people residing in shelters when there are no adequate staff to assist them?
I think that really speaks to the provider accountability aspect of this, right? And frankly, the DHS accountability aspect of this, right? If there are insufficient staff to engage with clients, then no client is going to be experiencing any kind of consequence here, and our focus is going to be making sure that DHS is appropriately working with the shelter to make sure that they are adhering to their contract terms.
Thank you, Commissioner. I was about to say the same thing, right? We expect that the 19 sites that are in this pilot will be able to actually do what we want them to do. And if they don't have, they're not ready to do that starting July, then we're not going to be discontinuing. We want to make sure that they're adequately resourced to move towards this. So there's work that's happening now with training and looking at what resources they have. So we're working with the providers right now to see if they're ready. So we're doing some upstream work for these facilities.
Okay. So why not just create, some steps to ensure that the providers are doing the work that they're contracted to do and encourage the clients to follow the treatment plans?
So frankly, that is the premise of the work that we do day in, day out, right? We have contract terms, we do contract monitoring. Clients are expected to adhere to independent living plans. That is the basic nature of the work that we do, and we continue to do it, and we will continue to do it. Understanding, though, that everybody, whether it is DHS staff, DHS is an agency, providers, clients, people have competing priorities, and sometimes being told this is what we expect of you gets us a lot of the way there, but not all of the way there, right? So we are looking for ways that we are making sure that all of us are being held accountable to the standards that we want.
Understood, but I think the training is really key, right? Because we want to make sure that we are hiring staff that is capable of, destabilizing and bringing down, controlling a situation, and that's not always the case, right? And so I worry when we are relying on others to determine what gross misconduct is, right? Like that, how do they define gross misconduct? And as opposed to somebody, I'm not saying that people aren't difficult, right? It is what it is. But if I work in a daycare center and I know that I may encounter a little biter, it doesn't mean that I'm going to be biting back, right? And oftentimes, because the staff is not adequately trained or educated in, social services or, mental health issues, they may not recognize what a mental breakdown looks like, as opposed to somebody just being, nasty.
Councilmember, I agree with you absolutely. The training piece of it is critical. And the fact that we have invested in DHS and DSS legal resources here means that there will be eyes on this every step of the way. So if we think a provider is moving towards action that is not inconsistent with our standards, then there's any consequences for the client are stopped, and we go back to the provider accountability act.
Yeah, I don't want this to become a punitive measure for
It is not
individuals that have differences in that type of setting.
Absolutely.
The last piece I would add is that we have a structured training program for this, right? So there's training that we have made sure that we have put together, structured, we're keeping track who's doing it. There is makeup sessions for those who have missed it, health services, offices involved. There's lots of work that's happening to train just to make sure that we're hitting those points that you're making.
Yeah, I believe you. Your agency is pretty big, and it's really difficult to control, every aspect of human behavior, and that includes, our staff as well. I'm going to ask just a couple of more questions, and then I'll let the members ask, and I'll come back around. The executive plan includes an additional $77.8 million in city and state funding for cash assistance in fiscal year 25 only, increasing the cash budget, the CA budget for fiscal year 25 to $2.65 billion, but the budget for cash assistance in fiscal year 26 is $1.65 billion, $1 billion less than the budget in the current year. How was the amount of additional funding for fiscal year 25 determined? And is that funding added for a specific population? And if so, which one?
Thank you, Councilmember. It's not for a specific population. We're monitoring utilization and spending trends with OMB and adding as needed to make sure that we are going to have sufficient funds to get through the fiscal year, and we will continue to engage in that process into FY26.
Okay. Is the $77.8 million increase in funding within the current fiscal year an estimate of the need for the whole year, or do you expect to add more funding in the adopted?
We anticipate that this will get us through the end of the fiscal year, but we will certainly monitor that closely.
Okay, and how much was actually spent on cash assistance in fiscal year 24?
Hold on, let us pull that number. Cash assistance in FY24 was just short of $2.4 billion. That's a gross number, both city tax levy and other funding sources.
Okay. In fiscal year 26, the preliminary budget response, the council called on the administration to address the under-budgeting in the baseline for cash assistance. However, it was not addressed in the executive plan. Does HRA realistically expect the cash assistance expenditures will be $1 billion less than next year in the current fiscal year?
There are reasonable points of uncertainty in exactly how much we will spend and the balance between city and state federal funds. We work very closely with OMB to realign as we need to.
Okay. I'm trying to just jump through some of these more important questions. ACS stated that the city is facing a $1 billion deficit in funding for child care vouchers through the end of next federal fiscal year. As a result of the deficit last week, ACS has paused new family enrollment into the program, instead placing families on a wait list. The agency has indicated that growth in both population and state-mandated rate increases for child care vouchers are the drivers of the funding deficit, and that they anticipate a significant uptick in cash assistance clients utilizing vouchers due to the reinstitution of work requirements. When did HRA resume the mandatory work requirements for cash assistance clients, and was this immediately applicable to all clients on cash assistance, or was there a phase in over a period of time?
So we are in the very earliest days of re-rolling out the federally mandated work requirements. It has really just begun, so no, it was not implemented across the board, but I'm going to ask Administrator French to give some more detail.
Sure. Thank you, Commissioner. So yes, at the very end of April, we restarted the mandatory engagement work requirements for cash assistance clients. So what that means right now is for all new applicants, during their application process and the interview, they will be assessed for their employability, and if they're deemed to be employable, we'll connect them to the appropriate services we have, whether it's our career services programs for individuals looking for workforce development, for individuals who may have a medical or mental health barrier to employment, we'll connect them to our We Care program. For existing clients, we've started the process of calling them back in, but that will roll out actually through the end of 2025. So it is a phased approach that we're taking. Most cases and individuals will be engaged during their renewal period when they have to do an interview. We'll determine if they're still deemed employable, and they will then get referred as appropriate to the right services. So it's very much a phased-in approach. As part of that, right, we will see an uptick in the utilization of child care vouchers as we are.
We will, but have we started to see that?
We've just begun, so
Okay,
we have
so-
not begun. Right now, there are about 27,000 child care vouchers being utilized over the next sort of year and a half. So we'll see that number steadily increase to when we'll see hit a sort of plateau of probably around 63,000 vouchers that will be utilized. That is higher than our pre-COVID number for a couple of different reasons. One, our caseload is larger than it was in 2019 and early 2020, as well as there were some state changes to child care eligibility for those eligible to mandatory vouchers, where they will be able to retain child care for longer than they had prior.
Goodness sakes. Oof, what a year. The city's family homelessness vouchers. Okay, so the executive plan includes an additional $176.6 million in city funds for fiscal year 25. This new need brings the total City FEP's fiscal 2025 budget to $1.27 billion. Yet the budget in fiscal year 26 and in the out years is currently approximately $540 million less. Why was the additional funding needed in fiscal year 25, and how was this amount determined?
Thank you, Councilmember. We've been very aggressively moving families and individuals out of shelter with City FEPS. The City FEPS program is now over 55,000 households, which makes us the largest rental subsidy in the program in the country, but for NYCHA's Section 8 program. So, everybody else's Section 8 program is smaller than we are. The federal government has really abdicated its responsibility even before the current situation. Federal government has really abdicated its responsibility to provide rental assistance, and the city has stepped in to do that. So the rapid growth in the program has increased costs very rapidly. As I think I mentioned earlier, we've seen a five-fold increase in spending in about 4 years. That's largely driven by the growth in the program, although also rents have gone up during that time period as well.
Okay. How much of that fund has been spent to date in fiscal year 25 on City FEPS, and how much was spent in fiscal year 24?
In FY24, we spent $833.7 million. In FY25 through March, we've spent $907.5 million.
907.5 million, okay. And as part of the fiscal 26 preliminary budget response, the council called on the administration to add $25 million to address City FEP's administrative barriers and to provide funding to address the chronic underbudgeting of the City FEP's baseline. However, the additional funding was not included in the executive plan for either proposal. The call to address the underbudgeting of the baseline has been raised in the past, and continues to be of concern to the council. Given the actual spending last year and this year, are we well above the budget in fiscal year 26 and beyond, or is HRA advocating for an increase to the baseline budget?
So certainly our FY25 spending is greater than the FY26 baseline. We're working very closely with OMB, and we'll realign as needed. With respect to the operational I do think we have taken very significant steps internally to make sure that we are operating city FEPs as efficiently as possible. And the numbers really bear us out. I talked about the really significant increase in growth in the program, the increase in the number of people exiting shelter with city FEPs, and I think that is very much due to the fact that we have really, as an agency, come together to focus on city FEPs operations. We have a four-pronged work plan that we meet on regularly that is very much for exiting households out of shelter. We focus on getting vouchers into people's hands, making sure that anybody who is possibly eligible for a voucher has access to one. We think about housing supply. It's not traditionally the role of the social service agency to think about housing supply, but in a city with a 1.4% vacancy rate, if we don't, people aren't moving, so we do that. The third work stream is making sure that our providers have all the tools that they need to operate as efficiently as possible. So that has been training. It has been creating new materials. We have now what we call our concierge team, where we are sending DHS staff out to some of the shelters that seem to be struggling and really embedding them in the shelter for 4 weeks at a time to try and help them improve their move-out numbers. And then making sure that our processes are as streamlined internally as possible. So to give an example there, one of the things that we do before somebody moves out with city FEPs is we check all the administrative records, like does the building have violations? Is it owned by the person who claims to own it? Things like that. And our staff used to do all of that manually, like literally they'd go on the HPD website and then the DOB website and then and it took a really long time. We've now automated pieces of that, and it has gone from a process that took a week to a process that takes 24 hours, right? So there are dozens and dozens of projects that lead up to that, but I think the bottom line is, as I mentioned earlier, a 38% increase in the number of households exiting shelter to subsidized placement because we have been looking cross-agency at everything that we need to do. So, appreciate the council's advocacy for agency resources, but I also think we are very much making progress there.
I appreciate that. I'm going to allow for my colleagues to ask questions, just take into consideration that they have other places to be, and then I will come back around.
Thank you, Deputy Speaker. We first have questions from Councilmember Ressler, followed by Salam.
Thank you both, Chairs Brandon and Ayala. You both do a phenomenal job. And thank you, Commissioner Park, for being with us today. And team, it's always good to see you. I appreciated your testimony today. Is it fair to say that the committee markups on the budget reconciliation process in the House, that the cuts to food stamps and the cuts to Medicaid would be devastating for New Yorkers?
Yes.
Catastrophic?
Yes.
Okay. We have not heard that from the mayor or frankly from anybody on the other side of City Hall, so I just appreciate you speaking up and speaking out for low-income New Yorkers, for people who would suffer profoundly if these cuts come to fruition. I think that there was a news alert while you've been testifying that they're delaying the budget committee vote, and that's only because the far right within the House is pushing for deeper cuts that would be even worse for the people that we all care about. I just want to understand, as of the proposal that's working its way through the House, how it would impact New York. So $300 billion in proposed cuts to food stamps, to SNAP, and part of the way that they're looking to pay, for the states to pay more, is based on the error rate of food stamp processing. And my understanding is that in New York, we're at approximately a 12% error rate. Is that roughly accurate for the state?
Yeah, that is the right ballpark.
And slightly higher for the city?
Yes.
And we represent about 2/3 of the food stamp cases statewide?
Yes.
And so for an error rate that's north of 10%, what they're planning is that we would be on the hook for 25% of the food stamp payments that the federal government currently covers. Is that accurate?
Yes, with the caveat, obviously, that this is very much a moving target.
It's fluid. Yeah,
reading
understood.
all the same things you're reading.
Yeah, I just want to make sure that we all understand what the impacts are. So you testified, and we all know it's about $5 billion in food stamp funding that we're talking about overall. So if we were on the hook as a state for 25% of it, we're talking about a 1.25 or so, roughly, ballpark, fluid process. Nothing's even been voted out of the House, let alone the Senate. But we're talking about a $1 billion plus cost shift onto New York City or loss of food stamps.
Yeah, but I'd like to take a minute to talk about the error rate process. It is not possible to get more wonky than this, but I think it is incredibly important for people to understand how these error rates are calculated. On a monthly basis, they pull a sample of 7, literally 7, right? We talked about the size of our SNAP program, right? They pull this tiny sample of cases.
I'm already out of time.
And it is, and my colleagues will correct me if I get any of this wrong, because it is very complicated, but it is a case that is active. That doesn't mean a case that was processed in that month. So when you have an issue, for example, there was a tech glitch and a notice didn't go out 8 months ago. And that happens, sometimes it's on our end, sometimes it's on the state's end. Things happen, right? A notice didn't go out. The fact that notices didn't go out for a month affects an entire year's worth of those samples on the error rates. They also count client error rates and agency error rates exactly the same way. Administrator French or Jill, anything you want to add on
No,
that?
that is correct. It's a very small sample that isn't representative of actual also sort of real-time current what's actually happening in the program.
So one of the things that I think is incredibly important is that if and when we are talking about these unbelievably high-stakes decisions based on this very poor quality data point, like that is very disturbing to me.
I agree with it. I think that the other reality that we will be facing if this is enacted is that there's going to be enormous pressure on you to crack down on every single food stamp recipient that may have gotten $3 extra or $5 extra unintentionally or whatever the case may be to drop that error rate because there's $1 billion+ at risk in funding. And so we're going to see aggressive fraud prevention tactics that make it harder for people to get the benefits that they need. And I think a return to the kind of Bloomberg-Giuliani era approach on this, because you won't have a choice to try and prevent that funding to try and protect city funding.
What I will say about the error rate is our focus isn't on the clients, right, and being punitive to the clients. What we're doing internally, because we do want our error rate to be lower, because we want to get it right the first time.
I do think that is the history of the agency. I don't think that's the current policies. I'm not criticizing you all. I do think that 10 years ago, during the Bloomberg and Giuliani eras, that was how things were approached, and I think you're going to see a return to that approach based on the way this funding is structured. I'm out of time. But I'm deeply concerned about legal immigrants accessing food stamps, as is proposed in the House bill, that legal immigrants, folks who are documented immigrants, would not have access to food stamps as in their proposals. I'd love for you to provide estimates on the number of people that could be potentially impacted by that here in New York City, considering 40% of our population's foreign born. I am deeply concerned about how this impacts specific geographies. Have you done any modeling for Congressmember Maliotakis' district for how many food stamp recipients are at risk of losing their food stamps, how many Medicaid recipients could be at risk of losing their Medicaid for her district in particular?
Thank you, Councilmember. With respect to the immigration question, don't have that answer with us. We can take a look at what we can provide. I will note that SNAP has very stringent rules already that you have to be in the country legally for 5 years before you're able to access SNAP. So, limited, certainly, and recent immigrant utilization there. OTDA has put out excellent one-pagers on SNAP utilization by congressional district. Happy to share those with you.
Okay, and Medicaid impacts?
I believe we have a similar documentation on Medicaid as well. Happy to share all of that with the committee. As I mentioned in my testimony, we've been really busy working with stakeholders, making sure that people have materials so that we can talk about the impact of these benefit programs by district, by different parts of the state. I'm a board member of the New York Public Welfare Association, making sure that we're partnering with my upstate counterparts, knowing that they have different access. And
I'm out of time and I'm in trouble. So just briefly, lightning round. I'm grateful for your advocacy. I think you're speaking up in a bold and clear way, and it's really important, and I want to thank you for it. Administrator French, could we seek like monthly updates from you on the child care voucher utilization so we understand what we're planning and preparing for? Is that a reasonable expectation?
I can follow up on what a right time frame would be, but we are tracking it, so we'll follow up with what.
Okay, we will. And then lastly, I know my colleagues have raised this, but we painstakingly negotiated $215 million in additional FEPS funding in City of Yes. It's not in the budget. Do you support it being included in the adopted budget?
so the city FEPS budget has grown very substantially, right, as we've added hundreds of millions this year. I'm going to need to circle back with OMB colleagues and others on exactly how things are being added and counted towards different commitments. But what I will say is we are passionately committed to the city FEPS program and support all resources for it.
We would love to work with you to get OMB to do the right thing. Thank you very much, chairs.
Thank you. Before we move to our next set of questions, I want to acknowledge we've been joined by Council Members Williams on Zoom and Moya. I also want to welcome to the People's House Our Lady of Mercy Catholic School. Thank you for joining us today. We're now going to turn to...
Mr. Chairman, I'm sorry.
Oh, sure. Go ahead.
I just wanted to take this opportunity to thank you and to thank Deputy Speaker Ayala just quickly for just an interruption, because I'm here with my niece, who is part of the school that's here today at Our Lady of Mercy, and we also have Mr. Duffy, and I think that this is such a great opportunity for them to see government at work and see how hard all of the council members and colleagues have been working here. So thank you, Annabelle, and thank you to all the kids that are here today. Thank you, Chair, and thank you to Deputy Speaker Ayala for the interruption.
Thanks for visiting us today, guys. Okay, we're now going to turn to Councilmember Salam, followed by Councilmember Aviles.
Thank you, Chair, and good morning. So the executive plan added 35 outreach positions and $9 million for subway outreach. How many of these outreach workers are stationed in Harlem subway hubs, such as 125th Street? You know, Harlem has been a high contact area for unsheltered individuals. How is DHS ensuring adequate coverage uptown?
Thank you, Councilmember. I'm going to start and I'll pass to Administrator Carter. We work both with our contracted outreach providers and the DHS staff. Generally, individuals, and whether it's contracted or DHS staff, aren't assigned to one given station. We have the largest outreach program in the country, but in total it is about 400 people. So given the size and scope of New York City, we do move people around through the system. But we look at data based what we hear from our outreach teams, what we see on 311, reports we get from other sources, and we make sure that we are directing resources to places that we know have a higher concentration, and certainly parts of East Harlem fall in that category. But Administrator Carter, would you like to add on?
Thank you, Commissioner. And Councilmember, to your question about being assigned, what we do with our outreach teams is that they are rotating throughout the city and throughout the boroughs. And in terms of the subways, we are, based on data, based on 311 calls, is where our outreach teams are assigned. And so we are looking at kind of big picture of the entire city. We do have our Manhattan outreach teams that are in Manhattan throughout, and so if there is a influx of really where there are outreach teams and members are needed, then we will be able to look at the data and have them go there. We also, 311 is one of the biggest drivers of where we're going to, and so we're looking at that data to drive our teams around. So that's how we get that.
Yeah, I'd definitely like some follow-up on specifically Harlem, seeing that hub is such a highly challenging area. I want to move to peace officers and misconduct. In April 2024, New York Focus released a report about DHS peace officers who provide shelter security. The article focused on peace officer misconduct and detailed DHS's failure to discipline peace officers, taking 6 months or more to suspend officers found guilty of misconduct, with the suspended officers often able to return a month later. The article also mentioned that peace officers have trained with the NYPD since 2017. Can you tell me more about the training the peace officers received? Do you think that the NYPD training is appropriate for this role?
Thank you. DHS actually have our own training academy that is licensed by New York State. And so there is, for us, it's our comprehensive training academy where we train DHS police officers. And then we have our deputy commissioner that is able to, with her staff, look at what's happening in terms of disciplinary for our police officers. There is absolutely a oversight of what's happening with our police officers. They are standards of expectations of behaviors. They do de-escalation training. They do conflict resolution. And so they go through that, looking at what's happening there in terms of disciplinary. We are licensed by state. Then they have 8 hours of training that's happening within our police officers' training process. And so we are comprehensively trained. It is on-site, our academy, where we do the training.
And if I could just add on to that, the DHS peace officers were under the auspices of NYPD from 2017 until 2020. In 2020, the NYPD involvement in the DHS security officers was ended, and we have since managed that entirely on our own since then, which is, with Administrator Carter is noted, we have our own training academy with a focus on trauma-informed care.
Gotcha. Just a follow-up in terms of when there are instances of misconduct, how are residents that are sheltering able to report those instances of misconduct?
Oh, thank you. So every provider and every resident that we shelter have the opportunity to make reports to either the shelter director or straight to my team. And when that does happen, then we do follow-ups with the directors, and we actually go on site to see what's happening there. So there's an opportunity for them to get investigated of whatever the reports are.
We also have an ombudsman's office where people can report if they're not comfortable reporting directly to shelter staff.
And just a final follow-up, how many reports of misconduct did DHS receive fiscal year 2024, and how many have you received so far in fiscal year 2025? And how many of these instances have been committed by maybe repeat offenders or such?
We'll get back to you with those numbers.
Thank you. Thank you, Chair.
Thank you, Councilmember. Now we have questions from Councilmember Aviles, followed by Stevens.
Oh, excuse me. Just making sure everybody's awake in the chamber. Thank you, chairs. I'd like a quick follow-up on Councilmember Salam's questioning. If you could also include how much of those have resulted in disciplinary action, that would be a very helpful data point for that group of questioning. I'd like to take a quick switch to DSS's protocol around immigration agents that are permitted into DSS facilities. As you are aware, there was in February 2025, there was an issue memoed to DSS employees and contracted providers that gave broad discretion and on compliance with federal immigration agents, saying, if at any time you reasonably feel threatened or fear for your safety or the safety of others around you, you should give the officer the information they have asked for or let them enter the site. Another version of that memo was distributed shortly after without the statement. Is DSS's position that employees and contracted providers should come under, contracted providers should, under some circumstances, comply with immigration agents even if they don't have a warrant?
our position, which city's position, and we have trained extensively with our shelter providers, is that non-local law enforcement are allowed on site only with a signed judicial warrant. We have had a relatively small number of instances of non-local law enforcement coming to DHS shelters. I am very grateful to the frontline staff who managed those very challenging situations very, very well. They were in direct contact with DSS legal team, and the policy of access with a warrant only has been thus far implemented very carefully.
Thank you, Commissioner. So I was just going to ask if you would, just for the record, I know we've had a lot of conversations about this, just briefly walk through the protocol when immigration agents show up to a DSS site.
Sure. If non-local law enforcement, and I'm using that term broadly because we've seen
Yes.
a fairly broad set of law enforcement entities, we ask for identification. We then will ask for, and we typically, we're talking about provider staff overwhelmingly. Our shelters are operated by providers. Staff are instructed to notify DHS and DSS Legal immediately that there is non-local law enforcement on site. We ask to see a warrant, and law enforcement's not allowed on site without a warrant. If they are refusing even to provide identification, at that point the direction is that they should deny access even to entering the building. We stop the interaction there, and if necessary, the direction is to call 911. We do not allow anybody on site into any of our shelters without appropriate identification. In all instances, we want people to be in communication with DSS and DHS staff and DSS Legal. Again, the frontline staff that have had to confront this very challenging situation have handled things in an exemplary fashion. Certainly, if we do receive a signed judicial warrant, then law enforcement is allowed on site.
Thank you. You mentioned there have been a few cases. Do you know how many specifically there have been of ICE attempting to enter DSS sites since the change in the federal administration this year?
I want to say it's about 6 incidents. 6 incidents.
Can you tell us, and you can get back to us, which boroughs those occurred in? And in how many instances they were permitted to enter the location?
I'll need to get back to you on the borough. I can tell you there's been 1 arrest.
Got it. Thank you so much. And I think I'm out of time. Can I have one? Okay. Forgive me, you may have discussed this earlier. We're going to go back to the $215 million around city FEPS. I heard you say that there was much more added to the program. I guess what I was curious specifically about is where we could see the reflection of the $215 million that was negotiated and added in, like where we could see that in the line item accounting of the program.
So in FY25, we've had hundreds of millions of dollars added to the city FEPS budget. It's more or less doubled. I need to consult with my OMB colleagues on how they are accounting for that and aligned with the City of Yes commitment.
So just to note, I think my colleagues may have said that it pains us that we have added resources to become a slush fund for other things potentially. So that's why we are so dogged in making sure that we see the addition of the resources, because this would not be the only instance where the administration has wanted to put the resources that we fought very hard to give agencies for very specific work to other purposes. So I appreciate you and thank you.
Always happy to do the follow-up. Just to clarify, certainly no slush fund. That is, the dollars I was talking about was specifically for city FEP spending.
Okay, we have questions. Councilmember Lewis.
Thank you, Chair. Good to see you, Commissioner, and your team. I have a quick question about burial assistance. HRA currently has 3,400 cap on funeral and burial reimbursements, which is outdated and insufficient, as we've discussed with the agency in the past. Has there been any movement in the FY26 executive plan to raise the ceiling to match today's costs? And if not, how does the administration justify this stagnation given that most funeral services in New York City exceed $5,000? And will HRA consider covering the cost differential for families in its greatest need? And I know the state has a component to this, but it would be good to know what the administration is thinking to address this for low-income families.
Thank you, Councilmember. I hear the concern. I will be honest that this is not something that we have been working on thus far. We can certainly discuss it during the adoption process.
Okay. It would be good to hear about it before OMB gets here so we could understand what the administration is thinking about and how much you're thinking to add in for the differential component. And just wanted to give you a heads up, we never got a follow-up from DSS or DHS regarding the child that died due to fentanyl at the Wynn shelter. So it'd be good to have a conversation with someone else on your team at a higher level.
Apologies for any lack of follow-through. We're happy to follow up offline. Certainly, that's not something that we should put on the record. And just to be clear on the burial costs, it has not been something that we have been modeling thus far. If you have a particular proposal you'd like us to take a look at, we're happy to do that.
Okay, thank you. Thank you, Chairs.
Thank you, Councilmember. I have a question from Councilmember Banks, Chair of our Public Housing Committee. He had to leave. In his district, it appears DHS is planning to convert 2 formerly designated migrant shelters into a 112-bed shelter for single men. This is at 272 and 268 Williams Avenue. Question is, how is the agency conducting community outreach regarding these changes? Specifically, what efforts are being made to inform residents, gather their feedback, and understand the community's perspective on how these transitions may impact the neighborhood?
Thank you. And we can certainly follow up offline on specific addresses, but generally with respect to shelter siting, our commitment is that to make sure that we have sufficient shelter to meet our legal and moral mandate to provide shelter to all in need, and we are very aggressively looking to get out of paying hotel rates, paying a night-by-night rate. We're in more than 16,000 hotel rooms. It is significant. Occasionally we do look, and bring hotels. At the need for shelter space, looking at what are we will always, as we go through the process, there's a limited amount of engagement that we can do before procurement happens, but after procurement happens, we always engage with the community. We do a formal notification. We will have a community board meeting if they would like. Every site has a community advisory board, but our goal is to make sure that we have safe, secure spaces that are cost efficient for the city and located across the city, consistent with need.
Councilmember Banks is also concerned about another shelter in his district that's set to open where it's apparently transitioning from a supportive housing facility to a full-on shelter. Isn't that going backwards?
I'm going to need to do the address. It is absolutely our policy not to take housing out of the housing stock, and particularly supportive housing.
All right, I'll make sure his team follows up.
We'll follow up on
with
the
you,
address there.
Okay, thank you. I'm turning it back to. Okay. I'm back to Councilmember Aviles.
Thank you. I'm going to change my voice. So, These are some additional questions regarding cash assistance and SNAP processing. So the preliminary mayor's management report shows a timeliness rate of 53.4% for cash assistance applications as for the first 4 months of fiscal '25. What is the current timeliness rate?
Very pleased to say that our timeliness rate is much better. So for March numbers, cash assistance is 72%, and SNAP is 93%. We have been very focused on this, and you're seeing the results.
Amazing. So let's see. Okay, you answered my next question. What are the timeliness rates for processing recertifications for SNAP and cash assistance?
Those are aggregate numbers. Administrator French, anything you want to add? Yeah, those are aggregate for new applications and recertifications.
The 72 and the
Correct.
93 are aggregate. Could you provide us with a break of those?
I'm not sure if we can break up the data that way, but we will take a look and circle back.
Okay, thank you.
Yeah, can I, if I
Oh,
just
yeah.
jump in here? The
For sure.
application, the timeliness numbers that we provide are only on applications. We don't calculate timeliness and report on timeliness for research.
For resorts, okay.
Thank you.
Thank you. So what are the specific steps the agency is taking to bring itself in compliance with state and federal laws regarding timeliness of process?
So when I stepped into this seat a couple of years ago, we had backlogs of tens of thousands of cash assistance and SNAP, both applications and recertifications, and I'm very pleased to say that is not the case right now. And that was the result of a very deliberate effort, again, of across the agency teamwork to be able to get there. We hired something like 1,000 people to do frontline processing on cash and SNAP. We invested in technology so that we are better able to process. We got some very key waivers from the state so that we were able to cut out some pieces of the process that we felt like weren't necessary. So there was a whole host of changes that we made so that we were able to handle the workload that we're getting. Application numbers are very, very high, and commensurately, recertification numbers are also very high, but we are staying current because we have put all of this investment in process and people. Administrator French, anything you want to add?
No, those are really what we've done, and I can just say on a monthly basis, we're constantly looking at the numbers, even on a weekly basis, to ensure that we're staying on track with that, and if we sort of see there might be some issue areas, we dig down very quickly to make sure that we can address that in real time.
Yeah, well, certainly congratulations on being able to dig out of that. Certainly we want to see as timeliness as possible. Given the context where we're anticipating increased needs, particularly if everything comes to pass, are you developing a plan on how to meet potential spikes in need?
Yeah, we sort of trend out what we know the peak months are going to be, in the future to plan for that way so that we can sort of ramp up and ramp down as appropriate. And we would basically look, if we start to see increased need, right, look at those different levers to see what would we ramp up or down quickly. And so we work very closely with our performance management team, who is really tracking these trends and able to sort of mirror to us what we might see down the road so we can prepare a little bit in advance so that we're not caught off guard.
And in terms of how does HRA plan to change or improve the New York City benefits program in the new fiscal year?
So the New York City benefits contracts with community-based organizations. Thank you. I just want to make sure I was understanding. So very pleased that we have the funding for FY26 for those contracts. These CBOs do critical work in communicating to clients and to helping people understand the benefits for which they're eligible. We actually had our first ever in-person convening with all the New York City benefits contractors earlier this week. I don't know, time has lost all meaning, but I'm pretty sure it was earlier this week. It wasn't something we'd been able to do in person before because this started during COVID, but it was terrific to bring everybody together. And as I said to all the CBOs who were in the room, I think, one of the things that we do well as government is create big systems that crank thousands of people through processes. What we don't do well is necessarily meet people where they are and communicate in their language, figurative language. Obviously, we care very deeply about translation, but so I think having those CBO contracts where, somebody who is a trusted messenger is in place to be able to talk about the benefits that are available to people is really important. And as I say, I'm very glad we have the funding for FY26 in place.
I'll turn it back to you guys. I may need another round.
Thank you.
Thank you. All right. I have a question regarding the Community Food Connection Program. I was very glad to see that the executive plan included an additional $36.1 million and an additional 6 positions to bring the CFC fiscal 26 budget up to $57 million. This is a critical program for families and individuals in need of it, and it's often the only choice for some of our city's most vulnerable residents, which is why the council has long supported and pushed for the funding, the expansion of this program. While this was a positive first step, I'm still concerned, that the funding was not baseline or increased to meet the growing need. The council will continue to push for fully funding this need. The threat of an actuality of federal funding cuts has already impacted the provider network and will cause food pantries to rely more heavily on CFC and city funding. As part of the fiscal 26 preliminary budget response, the council called on the administration to add $79.1 million to CFC's baseline to both restore one-time funding in fiscal year 25 and to expand the annual budget for the program to $100 million. How was the amount of funding added in the executive plan determined, and what are the 6 positions for, and how many are currently filled?
Thank you, Councilmember. I'm very pleased that we were able to add funding during the executive budget. The amount that was added brings FY26 up in line with FY25. The fact that we have the money available now allows us to make allocations so that the pantries know what they're going to get at the start of the fiscal year, which I think is going to allow everybody to be more efficient and will at least on the margins, will help with addressing the need that, as you acknowledge, is very real. I'm going to ask First Deputy Barry to speak to some of the additional details.
This administration has really invested unprecedented amounts of funding into the CFC budget, which we're very pleased about. Very happy to have had the money added in the executive budget this year so that we can make the FY26 allocations timely for the start of July. We have worked closely with other partners to help reallocate some of the CFC funding to fill in for those pantries that lost federal funding. That was not our funding that was lost, but in recognition of the whole network and in support of the entire network. We'll have to get back to you on the additional 6 staff add. This budget includes the budget code includes not only CFC, but also the Mayor's Office of Food Policy. So we'll have to get back to you on the details of the ad.
Are you guys advocating for the funding to be baselined? Or are you just asking for restoration, an increase?
We certainly work very closely with OMB on CFC. They understand the critical nature of the program.
Okay. There have been multiple federal cuts to large nonprofit organizations providing food assistance services in the city. These organizations operate food pantries and soup kitchens that many provide to millions of hungry city residents in need of each year. Given that many of the providers within the CFC network operate on a shoestring budget and are staffed primarily with volunteers, how is HRA helping to ensure the viability of these organizations? And how is HRA supporting its CFC providers who have already lost other funding or are at risk of losing funding due to federal funding cuts?
Yeah, this is a really challenging situation. We're aware that there's, forget the federal 26 budget, but that there's been very real pullback from an emergency food spending already. As the governor has said, as the city budget director has said, as I testified in the preliminary hearing, right, the scope of cuts that are either have happened or are set to come are such that the city and state are not going to be able to backfill anything. But we are in constant communication with CFC partners to the extent that we have resources that we can use to plug emergencies. We certainly will. And I think, as Jill and I both said, having our allocation now means that we can think about, how we can get things as efficient as possible. And we are always thinking about additional ways that we can support people doing and organizations doing this really critical work.
And if I could just add, one of the things we're doing differently also over the last few months is not just operating in a silo, but working very closely with the other agencies within the city that do receive state funding for emergency food and federal funding for emergency food and other food sources to make sure we're all collaborating together to make sure that we are getting food really where it is most needed, that we're coordinating on that and filling in gaps wherever we can.
And I want to recognize and appreciate that you did follow up from last hearing regarding adding some brick and mortar locations in the Bronx. Nonprofit organizations provide community-based human services on behalf of the city to our most vulnerable residents. This is especially true for HRA and DHS. DHS's contract budget totals $3.7 billion, which is nearly 90% of the agency's budget, largely relating to shelter services. HRA's contract budget is $1.04 billion, which is nearly 9% of the agency's budget, and includes programs such as domestic violence shelters, workforce development programs for cash assistance clients, and food pantries. Many nonprofits are struggling because city contracts do not provide for the actual cost of providing services, and payments are often delayed. In October of '24, MOX launched a payment backlog initiative focusing on clearing outstanding payments from fiscal year 23 to 25. How is DSS working with MOX to ensure that providers are receiving their outstanding payments?
Thank you. This is absolutely a serious issue. We know that we can't do the work that we do without our not-for-profit partners, and they can't do it if they don't get paid. What a not-for-profit experiences as a lack of payment is frequently a symptom of a variety of different challenges on the city side. So it could be a delay in contract registration. It could be a delay in approval of a subcontractor. It can be an invoicing issue. It can be the processing of a new need and the approval through the agency and OMB. It can be getting a contract mod actually processed. All of these things are different, but at the end of the day, they all have the same outcome, and that the not-for-profit isn't getting the funding that they expect and need. So what that means is that we are working across the board on all of those streams simultaneously, really trying to make sure that that we are processing invoices, but also doing mods, but also working with OMB on new needs, right? That full spectrum. I can say we've put out hundreds of millions of dollars in cash into not-for-profit hands in just the last 6 weeks or so. We've been really very, very focused on this. And MOX has been an important partner in this. So they've made a change to their technology and process so that instead of invoice review being a 4-step process, it's a 3-step process for DHS in particular. That has made a huge difference and allowed us to move quickly. One of the things that we know is coming later on this, we hope fairly soon. Right now, if we want to process a mod, so we want to move money around, add money, there can't be any active invoices, so providers have to make the choice about do they want to be moving invoices or do they want to be moving a mod, and it's a very challenging dance. I think my understanding is that MOX is going to be making some technical changes so that we can do things simultaneously. That will make a huge difference.
I mean, but it couldn't come fast enough. Do you know what the average length of contract payment delays is and in a number of days that the providers are experiencing? And at well, ask that first.
Yeah, so again, what is a payment delay is actually can be the symptom of all of these different things, so which are all tracked in different places, and monitored differently, so I don't have a number. What I have for invoices for DSS as a whole, it's about, on average, 28 days from invoice receipt to payment. It's a little bit shorter on the HRA side and a little bit longer on the DHS side, and that's something we're working very hard on.
That's the average, more or less.
For invoice payment, yes.
Okay. Yeah, I mean, that's not necessarily what we're hearing from some of the providers, and many of the providers are, have expressed concern that they will have to, shut down operations because they simply can't make payroll.
We know we have a real issue, and it's something that we're working on, and I think it's this, when a not-for-profit is not getting paid, and I, I'm taking that on face value. I believe that their financial issues are real. In some cases, it's a problem with an invoice, and there is certainly variation around that average, but sometimes it is, they can't invoice because we have a new need that has been stuck in the approval process for 6 months, right? So the end result is the same for them. They are not getting money that they need, but it's that particular issue wouldn't be factored into the average invoice process that I gave you because they actually can't invoice on that particular cost. But DHS in particular has been doing some, I think, important engagement with not-for-profits. And Administrator Carter, you want to speak with that?
Sure. Thanks, Commissioner. And so, Deputy Speaker, what we have been doing is meeting with each individual providers, and we have done actually 72 of those individual meetings. At the end of this month, we would have done virtually all. We've done, so these are meetings where we have everyone in the room, right? It's our programs folks, it's our finance folks, it's our budget folks. We even had mocks in the room because we want to really look at where are the holes, right? And so we don't want to work in silos anymore, right? So in that space, we are pulling up passport, where are the holes, so that we could figure out why things have not moved. And so we're also doing office hours. It is, and out of these meetings and what feedback we're getting is that they've really been helpful. Our expectation for the next fiscal year is that we're in a better place than where we are this year. We know that it hasn't been going well, and so we have acknowledged that with our providers. But we think that, this is why this is happening, but when we sit in the room with all of us in the space, we're like, oh, this is what the hold is. And so we've been doing these meetings every single week, practically every single day, with the highest level of staff. So the first deputy commissioner is this person that's doing it, actually with on our DSS side, the lead there, Marks is there, So we really want to make this a place where we can resolve these issues. And so we've put this in place. The work is tedious, the work is hard, but we expect the outcome to be a place where we're going into the next fiscal year in a better place. So, we've taken this very, very, very seriously and intentional to make this that we can put some parameters in place, and then we put structure. We're also looking at, is it the right way we've been doing this work, right? We also have gotten away from it's you, but, it's all of us to make this work better.
How many number of contracts?
Remarkably challenging question to answer. So DHS program staff have responsibility for engaging with providers and doing invoice review. But that's not their only responsibility. We have our budget team and our capacity team are both touching the contracting process, and the budget team's also touching the invoice process. And then when you get over to DSS, we have our ACO's office, we have in our finance shop, accounts payable is obviously touching everything. So we have, for any payment that goes out the door, we have a lot of people who are touching it. One of the things, as Administrator Carter noted, that we are looking at is whether or not there's a better way of organizing things. So we are working on both a emergency front of making sure that we are getting dollars out the door today, but also thinking longer term, so that we should be doing things differently so that we prevent reoccurrence of the situation.
Yeah, that's a lot of hands. My mother used to say, too many people stirring the soup, it's not a good thing. And I think that's part of the problem. There's a lot of bureaucracy within the, the agency, and, things kind of get lost. And only because I hear from my constituents, I've submitted documents and they've gotten lost, and then I have submitted them again and they're still saying they didn't get them. And then my staff is saying, well, we submitted them on behalf of the constituent and they're still saying they didn't get them. That concerns me, right? Because the system is just so large that it's difficult to keep these things. So streamlining them is really important. I think a more consolidated unit that deals specifically with contracts is probably the better, alternative.
I mean, separation of duties and extra, eyes and oversight has its place, and we do need to make sure that we are all keeping a certain level of accountability in there, but we agree that this is an area that is ripe for refreshing.
Yeah, and you did mention that the contract providers receive in advance?
So traditionally, DHS provider, or all providers receive, human service providers receive a 25% advance. This year, all providers, human service providers citywide, received a 30% advance, and then we have worked with not-for-profit, some of our providers to do additional advances on an as-needed basis. For FY26, the city will be doing 30% advances for DHS providers, with a potential for an additional 25% advance mid-year to the extent that it's needed. Other human service providers will receive a 50% advance at the start of the fiscal year. I would also note that families with children shelter providers are paid based on we call it care days, which is essentially they certify how many bed nights were used, and then we pay up front and then do the invoice reconciliation after the fact. So families with children providers are essentially receiving a month-by-month advance process as well.
I appreciate that. I had a question here regarding the crib pilot. The city's proposed a research program for the crib pilot that would randomly assign pregnant people at PATH intake to one of three groups. Group number one would immediately receive a group that receives immediate city FEPS, 2, a group that receives Pathways Home, and 3, a control group who receives nothing. While the rule hearing has not yet taken place, we would like to know more about the rule change for the crib pilot. Will HRA release a report on the outcomes of this pilot? What measuring factors will be used to indicate the outcomes?
Thank you. I'm really excited about this pilot and always happy to have the opportunity to talk about it. So you described it very well. The rule changes were necessary to allow all of that. Typically, there are certain eligibility requirements for city FEPS and for Pathway Home that we are bypassing for this pilot. Given that we haven't launched, we haven't exactly gotten to the point of thinking about how we will roll out the results, but it's certainly something that we are looking to learn from and are happy to talk to the council about it as well. The details that we are going to be looking, the metrics that we're looking at to evaluate success is both how many shelter nights used. I think our hope is that those receiving the subsidy will ideally avoid shelter altogether, but certainly exit faster if they aren't able to avoid altogether, and then looking at the number of babies born into shelter and homelessness. We have ideas for secondary metrics, but those are the two that are most important. Administrator Carter, anything you want to add?
Yeah, thank you, Commissioner. I think for this one, the goal really is to really have babies go in permanency, right? So our ultimate goal is to have families not be in shelter. So, right, it is one of the things that we really want to see happen out of this 1 year, and hopefully we think this is what we would love to see happen, and we'll see what the outcomes are going to be.
Okay, but the Pathway Home program requires that a person have a friend or a family member that they can move in with. And the program will provide monthly payments for up to 12 months. How can people be randomly assigned to the program for research purposes if there's a condition that requires them to have a family or a friend to live with?
So nobody is going to be denied shelter, right? So if you were in the Pathway Home group and you do not have an appropriate place to live, a family or a friend where you can use that subsidy, then of course you're eligible for shelter, and you'll be eligible for the housing subsidies that you might become eligible for under normal course of business. So nobody is being denied anything that they would have access to today before the initiative launches. The reason we are doing this is, and this is me, Molly, speaking personally, my hypothesis is actually that Pathway Home will be a really valuable tool here. We know that the city has a really low vacancy rate. It's hard to go out and find an apartment. Also, knowing that having a baby is a really tough moment, and actually being on one's own, particularly if you're a young parent of a first kid, that could be challenging. And actually having a situation be financially viable to be with friend or family, that might actually be a really good option for stabilizing and dealing with this particular point in transition. But that is my personal hypothesis. I don't actually know if it's true. If what we find is that most of the people who are assigned to the Pathway Home group end up entering a shelter and sort of behaving more or less like the control group, then what that will say to me is that Pathway Home isn't the tool that we should be using.
Okay. The city
Deputy Speaker, before
Yes,
we
go ahead.
continue, it's 84 providers, not 85. Just want to correct that on the record.
Okay.
84, not 85 providers.
Regarding the city FEP's increase the baseline household contribution, another part of the rule change is to increase the baseline household contribution in the 6th year of participation in the city FEP's program from 30% of the household monthly income to 40% for the households who have earned income and are granted additional renewals for a good cause. Can you detail what constitutes good cause, and how will HRA ensure what city FEP's voucher holders are aware that they're aware of this change?
Thank you, Councilmember. So at this point, about 90% of City FEP's voucher holders renew at year 6. So although the regulations have this good cause language in there, we have been taking a very, and at the moment plan to continue taking a very expansive definition of what good cause means. So the majority of people, as I say, are renewing at year 6. The communication, we will make sure that this is widely communicated. We obviously are in contact with all City FEP's voucher holders because they're receiving a subsidy from us, so we will make sure that is adequately communicated.
Currently, how many city FEP voucher holders are in each year? 4 and 5 of the program, and how many are in year 6 and beyond?
We can circle back with exact data. What I can say is a fairly small minority are in the out years, simply because the program has grown so rapidly over the last few years, right? Because we've added, the program was much smaller a few years ago, so there haven't been that many people who have aged into the later years. And so as a result, it is weighted towards those early years.
Do you know what the projected cost savings on an annual basis from this change will be?
Once it's fully rolled out, this will obviously, because it's 1 year at a time, it will take some time. But as it is fully rolled out, it's around $11 million a year. And let me just take a step back and reiterate what I said in my testimony. This was not a change that we undertook lightly. I am deeply committed to the City FEP's program, and I want to make sure that it continues to be a lifeline for people who need it. The 5-fold increase in spending that we've had over 4 years is really challenging and frankly not entirely sustainable. So we are taking looking at a number of different ways that we can bend the cost curve. This is one of them, but we're implementing rent reasonableness, right, to make sure that landlords aren't overcharging for units. I think an important one that we did in conjunction with HPD earlier this year is making some really significant changes to the augmented City FEPS program, where people were using City FEPS in middle income units. It was an idea that I really supported at the time, but I think landlords actually took advantage of it in ways that we didn't anticipate, and were leasing up entire buildings with augmented city FEPs and in ways that actually was pushing market rents. So pulling that back is going to I think be good on multiple levels, including changing the cost. So the goal really is absolutely not to put this all on tenants, but I have to make sure that we have a city FEPS program that we can sustain, and growing at the rate that we're growing is not viable.
Do we know what the average income is for individuals that have work requirement, that are eligible but are working?
I don't have that off the top of my head. We can circle back.
I mean, I have serious concerns with this program. I don't think $11 million is enough to make it, it's not as cost effective as damaging to families. I say that because my family grew up in public housing, and we paid 30% of our income on rent, and later on I had Section 8, and I had to pay 30% of my income on rent, and it was always the gross income, not even the net income. If you have if you have no children, or if you have children, like, depending on how many you have, right, that really affects what that net income is. And 30% for me was very difficult, because it meant that my second check of the month went, 95% of that went towards the rent for the following month. And you factor in the cost of inflation, food costs, childcare. Utilities are ridiculously high. I don't understand how, and I'm trying to be fair here, because I don't believe that the city should have the sole burden of financing these type of programs. I think that we need to be creating more what was known as Section 202 housing for older adults, where we have, project-based Section 8 opportunities. We need to be fixing and really investing in our public housing stock, so that we can bring back online, all of the units that have been sitting there warehoused for years. The federal government has a responsibility to expand on the Section 8 program, because this is a reflection, right, of the amount of people in New York City that cannot afford affordable housing. They need subsidized housing. And there's a very big distinction between the two. But in the interim, while we are responsible and while we're trying to figure out what those alternatives are, been on the receiving end of that, and I know what it's like to, even, people just assume because the family is receiving food stamps that, they're lazy, and they, it's not a party to have to survive off of those benefits. I'll tell you that, the amount of food stamps that, most families get maybe takes them to week 3, if lucky, and that's only because most families have children, and they go to school, and they have breakfast and lunch in school, so you're able to stretch those food stamps to maybe the 3rd week of the month, and that means the 4th week of the month you have to get creative, and sometimes that means you may have to go to the food pantry like my mother did and get those cans of whatever creative meat it's in there. I have no idea what we were eating. My mother made it taste really, really good, but we have to do those things in order to subsidize the needs in the household. And I would ask, and again, we'll make this ask also of OMB. $11 million doesn't seem like enough money. I'm sure that we could find 11 million someplace else without having to take it off the backs of some of our neediest New Yorkers.
I appreciate the perspective. I certainly understand that it is very hard work to be low income, and that there are a lot of challenges. Again, my goal is really to think about how we can ensure that we have a strong and sustainable City FEPS program going forward, that I can continue to issue new vouchers to those in the shelter system in need. And I echo your sentiment that hopefully other levels of government will get involved. We're very happy that the Housing Access Voucher Program passed for the first time at the state. Great start, but that's a $50 million program statewide, and we're spending $1.2 billion on City FEPS.
Thank you, Deputy Speaker. Wanted to ask a question about affordable housing services. The executive plan includes city funding of $28.4 million in FY25 and $33 million in FY26 for affordable housing services. What programs or services will this funding support?
I'm so glad you asked. This is one of my favorite programs. So Affordable Housing Services Program is essentially a project-based city FEPS program. The way it works is that rather than giving each tenant a voucher, the vouchers are put into a contract along with some maintenance and operation costs and light touch social services. The contract can either be 9 years or what we are increasingly doing is long-term 30-year contracts. And the not-for-profit can then go out and lease or with the long-term contracts acquire buildings. And then the housing in these are permanent housing projects. The housing is set aside for those coming out of the DHS shelter system. So effectively what we've been able to do is convert social service dollars into actual housing finance tool, which is great. In a city with a 1.4% vacancy rate, we absolutely have to be turning over every rock that we can to find more affordable housing, more options for households coming out of the shelter system. So the funds that were added to the budget are covering those contract costs. So it's a mix of rent, operations, and light touch social services. We have done I think about 500 of these, with another 400 or so in the pipeline. In many cases, these are buildings that were built really pushing the market, as market rate housing, really pushing the market. Not-for-profits have been able to buy them, leveraging the contract. And something that I think is really exciting about it is that they are leased up fully leased within a few weeks or to a month of closing on the financing, as opposed to, I love my colleagues at HPD, but sometimes the lease-up time on those buildings can be very long.
And could you tell us how those funding amounts were determined?
Sure. So we have a model that we negotiated with OMB. It is the city FEPS rent for given unit sizes, and then there are tiers of operations and social service costs that depend on both the size of the building and the mix of the units, right? So a building that has more one bedrooms is going to get a little less financing than funding for those operational costs than a building that has 2 and 3 bedroom units, things like that.
And then what is what's HRA's process for determining which clients with FEPS vouchers to place in the units?
So we work with, it's a combination between HRA and DHS. We're looking primarily at those who are long-term stayers, but who do not need the level of services that a supportive housing building would provide. There is ongoing services on site, but it does not rise to the level of social service. So it's not going to be people with serious clinical needs. And then, so we're matching between sort of who is City FEPS eligible, long-term stayer, right household size for the given unit, and where client preference and other needs line up. So, if a client says, I absolutely positively want to be in Brooklyn and the building is in the Bronx, we will probably not refer them because it's not a great housing fit for them. They're unlikely to stay. So it's a little bit of a retail process, but as I say, we have been able to move very, very quickly on those, and they've been terrific. I mean, just to give one example, I was at a ribbon cutting for one of these this fall. And there was a young man who spoke at the ribbon cutting. He was, I think, some 21. He'd been in the shelter system for a couple of years. He didn't need supportive housing, right? He probably wasn't going to qualify for supportive housing. He didn't need supportive housing. But I think back to myself as a 21-year-old. I wasn't capable of living completely on my own. I called my mother for everything, right? But he didn't have the family resources to be able to do that. So being in a permanent housing setting where he had somebody who could call and be like, hey, I actually don't know how to, get my cable set up, or I don't know how to maintain my benefits. Can you help me with this? Can you help me with a referral to an employment program? That, I think, is going to be the difference between success and failure for a young man like that.
Okay, I want to ask about the SHARE program, Special Housing Assistance Resource Program. Has the program launched?
Yes.
Okay, do we know why it keeps getting delayed?
It has launched.
When did it launch?
In March, I believe. So when the funds were appropriated at the state, they created this rental subsidy program and then virtually immediately clawed back most of the money for New York City. And there was an extended process back and forth with the state to determine how much was left in that allocation from what they had clawed back for how much we could use. So that added some time. And then the second source of delay was given the nature of the population that we're serving and we really needed to have a contracted entity. We couldn't use the normal mechanisms that we had to pay rent, so we went through a procurement process. We have hired Anthos Home to be the administrator for that, but now that we have the contract in place, we are off to the races, and we have had households move out of shelter already.
Okay, just a couple more from me. I'm bouncing around here. Wi-Fi at DHS shelters. How many DHS shelters currently have Wi-Fi?
So virtually all of the families with children shelters have been wired for Wi-Fi. This started during COVID. The funding that was included in the executive plan is for a few remaining sites and to help with the ongoing operating costs.
Okay, that's good to hear. The direct cash assistance pilot, as part of the FY26 budget response, we called on the administration to allocate $4.7 million to create a direct cash assistance pilot program to support justice-involved individuals, including those who have recently left incarceration, who live in communities with the highest rates of gun violence. No funding was added in the executive plan for these two initiatives. Does HRA foresee any funding being added to support those initiatives?
We're happy to talk to OMB about that.
Okay. Are there any new needs that you asked OMB for that you're still waiting to hear back?
We are in constant engagement with OMB about our budget. We've talked about a number of the places where there are distinctions between the FY25 spending and FY26 budget. Those are ongoing conversations, but we appreciate the partnership with OMB, and as I say, we're in regular communication.
Okay, last question from me. Does HRA feel that the current domestic violence shelter system has enough capacity to fully meet the level of demand?
This is something that we look at regularly. We do routinely have vacancies. There can be sometimes misalignment between household size or specific geographies, but we do routinely have vacancies in the DV system. But Administrator French, anything you'd like to add?
No, I think that really covers it. The level of facilities that we have, we do think covers the city, but there is oftentimes a challenge at times around boroughs or family composition and matching that up with what might be available. But we have a very close relationship with DHS, and we've also implemented, a process as well to connect people to DHS, where the DV system, either they may have timed out because there are time limits to domestic violence emergency shelters where households can stay up to 180 days, but then do need to transition. And if there's not availability that meets what they need in the Tier 2 system for DV, we have a fast-track process with DHS to place individuals directly into sites that meet the different requirements that those families may need.
And just to clarify, that time limit is a state requirement.
Okay. All right, I'm going to hand it back over to the Deputy Speaker.
I'm going to allow Alexa Aviles to ask one more and final question.
Good behavior pays off. You see how patient I was? Thank you, chairs. I want to ask about legal services funding. In the executive plan, the fiscal '25 budget for immigrant legal services is $68.8 million, of which $25.3 million is funded through council discretionary initiatives. The funding for the immigration legal services has remained relatively stagnant compared to prior years, despite the influx of more than 210,000 immigrants to New York City since 2022. In the fiscal '26 preliminary budget response, the council called on the administration to add $109 million for the immigration legal services enhancement. What is the budget for immigrant legal services in fiscal '26 and in the out years?
For the out years, it is about $35 million thus far. We do very much appreciate our partnership with the council and the funds that get added for immigration legal services, and we certainly look forward to working with you in the future.
So for the fiscal '26, do you have a number on what the services is? Is it the same? Is it?
Sorry, the number that I just cited was the FY26 number specifically for immigration legal services, which is about $35 million. That is
So
in the plan
no
thus far.
increase to
$1 million. That is
so
in the plan.
no a violent federal government that's coming after our fort, 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 that's coming after our fort. Budget from the city for these services in particular.
Budget as a whole, we have not specifically asked for an increase to the IOI baseline.
Got it. Deeply dismayed by this information, but thank you. Thank you, Chair.
All right. I have a question regarding right to counsel. The executive plan includes $15.6 million in city funds for fiscal year '26 to support the right to counsel program managed by HRA's Office of Civil Justice. What is this funding? What is the funding added for, and how was the amount determined? And will this funding be used to expand coverage for eligible tenants?
Hold on, just. Thank you, Scott. So the 15.6 is replacing federal stimulus funding, so it doesn't actually increase the total amount of funds available. There is an additional $15 million that was added that is an indirect cost adjustment for those providers. And there was some fund, a small amount of money added for IOI, the 4.4 that was added for FY26. So there is a small amount that was added there.
Do you know what the total budget for right to counsel is in fiscal years 25, 20, and 26, and in the out years?
I'm an old person, I can't read the tiny font. So specifically for what we consider our right to counsel program, so this is the right to counsel and then the anti-harassment tenant protection services, total spending or total budget for FY25 is $204 million. For FY26, it is $197. There is some council funding that is in the FY25 budget that hasn't yet been added in FY26. The $15 million for the ICR adjustment is not actually included in that number as well because it needs to be cost allocated across all of the OCJ programs.
But once those funds are added,
It'll go up.
It'll go up, and it
Yeah.
should be relatively the same number.
Yeah, so it'll be assuming the council funds, and we thank the council for their partnership, assuming the council funds are added, FY26 should be slightly above the FY25 amount. Again, we need to allocate the ICR adjustment across the different program areas that are part of the larger OCJ universe.
All right. As part of the fiscal year 26 preliminary budget response, council called on the administration to add $2 million in funding to the Human Resource Administration and the Mayor's Office to end gender-based violence to establish a pilot program to provide free, brief legal assistance and full legal representation to domestic violence survivors in divorce proceedings. This request is in line with Local Law 5 of 22, which requires the establishment of a working group to make recommendations regarding a pilot program to provide legal services for domestic violence survivors in divorce proceedings and subject to appropriations to then establish a 2-year pilot program. Was the funding added in the executive plan for this pilot? And if not, when will the funding be added to address the requirements of Local Law 5?
I don't believe it was added, although any of my colleagues will correct me if I'm wrong, but we will circle back with our colleagues at NGBV to follow up on that.
Okay. All right. Thank you.
Okay, thank you all very much.
Thank you.
Thank you.
Okay. We're going to take a 10-minute break, and then we'll hear from the public. Thank you. Okay. Welcome back, everybody. Give silence in the chamber, please. We're now going to open up the hearing for public testimony. I want to remind members of the public that this is a government proceeding and decorum shall be observed at all times. As such, members of the public shall remain silent unless they are testifying. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant-at-Arms for inclusion in the official hearing record. If you're here today in chambers and you wish to speak, please make sure you fill out an appearance card with the Sergeant-at-Arms available on that back table. Once you are recognized, you'll have 2 minutes to speak on today's budget, HRA or the DHS fiscal 26 executive budgets. If you have a written statement or additional written testimony you wish to submit for the record, please just provide a copy of that to the Sergeant-at-Arms. And you may also email written testimony, if you don't have it with you today, to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted, only written word transcript. Okay, going to call the first panel. We have Emily Paez, Dianara Mos, I'm sorry, I couldn't read the handwriting. Calvin Michael, and Harold Alexis. Come on up. Okay, if you want to begin from the left. Sure, just make sure your mic is on.
Sure.
Say your name, and then you can begin your testimony.
Okay. Good afternoon. My name is Calvin Michael. Good morning. My name is Calvin Michael. I'm speaking on behalf of the Safety Net activists in conjunction with the Safety Net Project at the Urban Justice Center. I'd like to speak about a couple things today. First, I'd like to speak about DHS proposed shelter sanctions policy, whereby shelter residents can be kicked out onto the streets for 30 days for things like having an issue with your public assistance case, not securing permanent housing after getting kicked out on the street. It may even be possible for the same prior shelter resident to be swept up in the sweeps campaign that's going on at Washington Square Park. So we're strongly opposed to the sanctions policy. We don't need sanctions, we need housing. Even though it's, maybe necessary, it's a little bit more on, like I said, more negative side. Basically, let me wrap it up by saying, we think that City FEPS needs more staff, particularly like housing specialists. And the housing specialists need to have be more involved with the clients. Like for instance, they need to be more involved as far as helping them find housing actively, like giving them information, helping them, to get on suggestions for the internet, things of that nature. And also lastly, the Wi-Fi. I'm glad that they're adding Wi-Fi. So, because the shelter that I was in, I was like Clark Thomas Men's Shelter, 300 men on an open floor, no Wi-Fi, and we couldn't look for work. But one of the sanctions is not looking for housing. That's one of the issues that I wanted to post today. You're in a shelter, among 300 men, there's no Wi-Fi. How are you going to look for work? You can't look for work, you can't look for a job, you can't look for housing. And then you get sanctioned, you know what I'm saying? That's the whole thing. I end up right there. And then, you know, go ahead, thank you.
Thank you very much.
My name is Diana Ramos. I am a member of the Safety Net Activists, part of the Safety Net Project through Urban Justice Center. I am also a recipient of SNAP and CityFEPS and have received cash assistance until February of this year, when I finally got my SSI after many years. I am here to speak about my experience with HRA delays, from recertification issues to phone delays to issues with CityFEPS, and the fact that I wasn't notified about the housing allowance that was passed after I had already been receiving my voucher. I also have some concerns I would like to voice. I have been getting benefits since March of 2020. At first, I had no issues with HRA. Then in September of 2023, I was renewed for cash assistance, but not for my SNAP benefits. I didn't get my benefits until mid-month. In September 2024, I received my SNAP benefits late again. I found that my 2024 SNAP recertification application was just sitting on someone's desk waiting for approval. When I tried to call HRA to address the issue the first time in 2023, I waited on hold for 4 to 5 hours, only to be hung up on. This is not unique, but a typical experience for people receiving benefits. There is no way for people to get their issues addressed. In 2024, I was fortunate enough to have an advocate on my side to communicate with HRA over this issue and issues I've had since then. 99% don't have access to an advocate or a program or advocacy like myself. HRA needs additional staff to staff phone lines and at the offices to assist people. The impact of benefits being delayed for people such as myself is that their health conditions could be impacted immensely if they don't get their benefits, such as someone who is celiac who cannot go to a food bank due to gluten allergies, which could hospitalize them. For someone like myself, being a diabetic, there are certain foods I cannot consume a lot of. My blood sugars will go too high and then crash and will possibly hospitalize myself. There are thousands of people who would be getting vouchers if Mayor Adams had implemented the CityFEPS expansion laws of July 2023. Currently, these people are being evicted and or stuck in shelter while we await a judge's decision. While waiting, HRA should concentrate on making the CityFEPS process smoother and more efficient and to prepare for the influx of applications. Of course, let's not forget about those who are working and going into their 6th year CityFEPS are about to face a rent hike from 30% to 40%. This would devastate working families, impact children, and possibly raise the number of homeless. The 40% hike would not save the city any money and or put any more money in city coffers, but would cause an increase of spending on those who get evicted for not being able to pay their 40%. Those people would end up in homeless shelters or on the street, which would perpetuate a very negative cycle. My biggest fear is that though the increase would only affect those who are currently working, what stops a similar increase to be implemented on those of us who are receiving SSI, SSD, and retirement benefits after 5 years on CityFEPS? Thank you for your time. I welcome any questions.
Can I say one last thing? I am extremely grateful for the CityFEPS program. It saved my life, okay? Because I would be on the street right now, you know what I'm saying? It's an excellent program. I'm enjoying being on it. I think it's attentive to I have certain complaints, but for the most part, it's a great program. It needs to stay, it needs to stay, you know what I'm saying? I'm grateful.
Okay. Hi. Let me get my glasses. My name is Harold Alexis. I'm a native New Yorker and member of Neighbors Together and Vocal New York Homeless Union, grassroots organization that advocate for affordable housing and fight homelessness. I would want to thank the Council and the Committee on General Warfare for convening this budget hearing to discuss the City FEPS programs administered by the Department of Human Resources Administration. These programs are essential for New Yorkers who rely on them to secure affordable housing in a city that has become increasingly unaffordable. I want to share all my experiences with City FEPS as a community voucher holder who received assistance from HRA and Home Base. I would like to first address the proposed policy enhanced client placement support. During my time in the shelter, I was linked to an apartment submitted for a one-bedroom unit that I envisioned as my newfound beginnings, access to permanent housing and stability using my City FEPS voucher. I was told by my housing specialist, case manager, and that I would like to move forward and take the apartment. Unbeknownst to me, when I viewed my new apartment, it was not the same unit I signed up for. And it was a studio, when in fact I shared with my housing specialist that my preference is a one-bedroom. I was baited and switched by management of the building and breaking ground with no support from my caseworker at the shelter and rushed to move into this apartment. I felt my preference didn't matter and my autonomy to make decisions on my new home was not considered. Although enhanced client placement support was not being actively enforced, then my experience surely exemplifies what this proposed policy would look like. People feeling rushed and pressured to take housing that isn't right for them or risk being kicked out of shelter. I submitted a transfer request at home base due to medical concerns. I was later approved for the transfer voucher, but when it came time to update my transfer voucher, that's when issues occurred. Caseworkers and supervisors weren't responding to phone calls and emails. In December of 2024, I was informed during my visit to HRA, my annual voucher renewal, that my current rental assistance to my current residence was stopped due to a transfer. Please note, I haven't moved out yet, and Home Base continues to sabotage my move-out plans, lost the approved transfer voucher, and was told my request wasn't good enough. City FEPS stopped paying my rent to my current apartment, and I was told that I had moved, which doesn't make any sense because I never found an apartment or submitted a move-in package to move into a unit. The caseworker at City FEPS didn't present any proof, nor were there any remedies provided to fix this blunder. My public assistance case was closed, although I was in compliance with recertification, and now I'm facing rental arrears. Communicating with Home Base and HRA has been a challenge with delays to update my case. I've learned that I am entitled to utility allowances, but never was notified, nor have I received any payments to pay my utilities. Now, I'm in the dark due to having no assistance to pay my electricity bill, and HRA is delaying help to turn my lights on. Since incidentally, I went to HRA yesterday, and they've since they fixed the problem. My electricity is back on, so thank goodness for that. 40% of their income after 5 years. This will cause housing expenses to exceed tenants' budget, and with the rise of electricity costs and or other inflation, this will harm people. The thought is truly overwhelming. To conclude, to the entire council, please take into consideration that both HRA and Home Base have set me up in a deplorable and despicable housing situation, and I'm now at risk of eviction. Imposing rent burden on low-income New Yorkers with City FEPS to underdetermine their stability and self-sufficiency. This situation needs to be handled with care and concern. It will affect many City FEPS voucher holders if not resolved in a timely manner. No one should have to be in this predicament in a program that is supposed to keep low-income New Yorkers stable and permanent housing, but yet facing housing insecurity. Housing is a fundamental human right, and I will relentlessly advocate for justice and peace. I am deeply frustrated with the current situation and will not back down. Thank you.
Thank you all very much for your testimony. Okay, our next panel, we have Tammy Murray and Sarah Pennenberg from 32BJ. Okay, now we have Kristen Miller, Chris Mann, and Kristen Miller, Chris Mann, Allison Wilkie, and Agnes Kim. And we've also been joined by Councilmember Gail Brewer. Sure, you can start. Thank you.
Hi, good afternoon, chairs. My name is Allison Wilkie. I'm the Director of Government Affairs and Strategic Campaigns at the Coalition for the Homeless. So in hearing after hearing, Commissioner Park comes here and talks about the success of City FEPS in moving people out of shelter, how it keeps people successfully housed. But I want to talk about 3 ways that the city is trying to limit access to City FEPS. First is the agreement that was made as part of the City for All, City of Yes text amendment that would have provided $215 million for people facing eviction to receive City FEPS. It appears that the city is reneging on that agreement, and that agreement would keep, we estimate, 7,500 households housed if we had that $215 million investment. And that would be for 2 years for those households. You know, the administration appears to be walking away from this, and we really urge the city council to fight to make sure that money is going towards City FEPS for people facing eviction. The second way that I want to talk about the city limiting City FEPS is through the increase in the 6th year to the tenant's portion of the rent to 40%. You know, doing this would enshrine rent burden into city policy. 40%, it means that you are rent burdened. And who else has done this or tried to do this? President Trump in his first administration tried to raise the tenant's share of rent to 35%. For federally subsidized housing. The Adams administration is proposing going even further and raising it to 40%. It is a dangerous precedent to send, and I think we really need to push back hard on doing this, not only because of that precedent, but because this would harm households, and the $11 million savings that the commissioner is citing would disappear when you would see families entering shelter. I also just want to talk about the crib pilot briefly. You know, the city's putting forward this as a research study, but one of the interventions would be getting City FEPS, which we know already works. And so why wouldn't the city just actually provide City FEPS vouchers to all pregnant people arriving at PATH rather than creating this research study that would have a control group that receives nothing? I mean, it kind of violates the ethical principles of research, which say that you should offer any benefit to all participants in research, and yet this is creating a control group of pregnant people who would get nothing while offering the benefits to only some based on random selection. And you could do this, you could still have the research by just giving pregnant people all access to City FEPS or to Pathways Home if that's a better option, and just compare that to the status quo of what has been. Like, they don't need to have a control group here that is getting nothing while some people are getting this benefit. You know, I think I heard Commissioner Park talking a lot about reining in the City FEPS budget, but the fact is when people can't pay for their housing, it cascades into other parts of the city's budget. And so if we're not paying for it with City FEPS, we're going to be paying for it in DHS's budget, we're going to be paying for it in benefits, we're going to be paying for it in a whole bunch of other ways. And I'll submit full testimony, written testimony later.
Good afternoon, Chairs Brandon and Ayala, members of the committees. My name is Chris Mann. I'm the Assistant Vice President of Policy and Advocacy at WIN, the largest provider of shelter and supportive housing for families with children in New York City. Each night, nearly 7,000 people, including 3,800 children, call WIN home. As the federal government imposes deep cuts to housing and social welfare programs, New York City must step up to protect our most vulnerable. As Wynn laid out in Project Hope, we urge the Council to take bold, proactive action in the FY26 budget to mitigate the harm of these federal rollbacks. We urge the Council to allocate an additional $263 million for City FEPS to support approximately 10,000 households at risk of losing their Section 8 vouchers, invest an additional $10 million in direct cash transfer programs for families, youth, and individuals facing housing instability, building on last year's investment in the Bridge Project, and increase immigrant legal services funding to $80 million, ensuring immigrant New Yorkers can access vital protections. We also strongly oppose the administration's proposed changes to City FEPS, requiring households to pay 40% of their income toward the rent after 5 years on the program. The policy punishes the poorest New Yorkers, undermines the program's purpose, and risks pushing families back into homelessness, all for projected savings representing just 0.01% of the city's budget, which we don't expect to materialize, given that many of those families will end up back in homelessness. Additionally, the city must invest $40 million to fully implement Local Law 35, ensuring mental health professionals are available in family shelters, fill the gap in child care funding, which is essential to helping families transition out of shelter, and resolve ongoing shelter provider payment issues, which continue to destabilize critical services. New York City has a moral and fiscal responsibility to lead during these uncertain times, and we urge the Council to continue advocating for a budget that prioritizes families, protects against federal threats, and strengthens our collective mission to end homelessness. Thank you.
Good afternoon. I'm Kristen Miller. I am Executive Director of Homeless Services United, a member organization representing 55 nonprofits who deliver homeless services and shelter services across the city. I am submitting written testimony that echoes much of what my colleagues here have presented. What I wanted to focus on is a reaction to what the Commissioner was speaking about with payment issues. So, she has acknowledged that we have a problem, we have an issue with nonprofits getting paid. I have testified before you many times talking about the hundreds of millions of dollars that are collectively owed to nonprofits going back as far as fiscal year 19. I think the message for us to you is for you to please continue to push. We have seen some improvements, but the reality is we are barely ahead of where we were a year ago. So we hear a lot of things happening. It's like the track being laid, but the train is not moving. So somebody might have been owed $60 million, now they're owed $38 million. They are still owed $38 million. They're still paying $1 million in interest this year alone. This is funding that should go back into program. It should be going back into the mission of helping people in New York City. I think when the budget comes, when we're looking at the budget, we are happy to see that there was some money in there for MOCS, Mayor's Office of Contract Services. They need more staff and OTPS funding to make improvements to Passport. That was good to see. But we do see a decrease in DHS staff. Excuse me, Commissioner Park noted that there are many cooks stirring the pot, right? So we need more program staff, fiscal staff, right? We're not seeing that investment, and we believe that there is no way we will ever get ahead until there are more trained people to process the paperwork so that we have the ability to invoice. I look forward to working with you more on this. Thank you.
Sure. Just one quick question, then I'm going to hand it over to Councilmember Brewer. All told, your member organizations, how much are they currently owed by the city, approximately?
I would guess over $500 million, over going back many, many fiscal years.
Thank you. Councilmember Brewer.
I have a question. When I
people have vouchers, they have trouble getting apartments. So Laura Lazarus testified earlier about her organization that helps people get an apartment and then stay in the apartment. Is that the kind of organization that would be helpful to fund to keep people to get the apartment and then to stay in it, number one? And second, I'm trying to be nice to Home Base. I've been criticizing them for the last 30 years. But to me, there's just too many people going into the shelter, and they could be stopped. We'd stop them. I know how to do it in our office. So I'm just wondering, are there other ways, not just picking on Home Base, but that we could make sure that people don't go into the shelter in the first place? So it's getting them out and getting them not in.
I think to your first question, what we would really like to see is DSS revamp the way that City FEPS is administered and make it easier for that process to go smoothly. That includes, I think, giving third parties, like those organizations like ours who are trying to help people both get their shopping letters and use their vouchers, giving us some kind of access to be able to move those applications along. Because right now, all we can do is make phone calls, and we can't actually get things to move. Even just having a system, which should have already been in place, where people can look up the status of their own application would be important. There's a number of reforms that could be made that would actually just make the process go smoother, that really should be done at DSS.
Yeah, I mean, I would echo that. And in terms of Anthos Home, like Wynn works with them. They're a great organization. I think, in anything we can do to kind of be creative in terms of getting households placed is great. And I think their model has, a ton of potential and has worked well at Wynn. To the other part of your question.
And don't go there in the first place.
Yeah, the council acted, right? You passed City FEP's expansion, which would have helped, keep.
That was your
people
good
in their
idea,
homes
if I
in the
remember
community.
correctly, sir. Yes.
But yeah, so obviously that's stuck in litigation. But we know that if we can meet people where they're at in their homes and keep them there, that's a much better outcome than letting them go into shelter.
Yeah, just quickly, Anthos, I think I agree with all what has been said. The one unique thing that Anthos does bring, they are a member of ours, that they bring to the table is they are also developing a relationship with landlords, right? So they're all ends of the work that needs to be done, which I think is really important, so that landlords have someplace to go should there be some problem, right? Regarding Home Base, I think it's important to, and I'm glad you brought it up, the demand for Home Base has been exponentially growing over the years, and the budgets, the contract amounts to do this work has not. So now there are long waits often to even get an appointment with Home Base, which was not the original model. So I think it's easy to blame the Home Base providers, but in fact, they are now structurally not able to meet the demand. And I think that when we look ahead, if federal funding is being cut, if programs are being reduced, the important thing for us all to remember is that the people aren't going anywhere, right? So just because the sources, the resources are disappearing, we still need to serve them. So I think Home Base is going to become more and more important as we go forward.
Thank you very much.
Thank you all very much for all you do. 32BJ, you ready? All right, we got Sarah Pennenberg and Tammy Murray.
Good afternoon, Chair Ayala and Chair Brennan and members of this committee. I'm Sarah Pennenberg. I'm the political coordinator for Local 32BJ. 32BJ is the nation's largest union of property service workers, representing 185,000 members, including over 90,000 in New York. I am here today to urge the City Council to fund the back pay lawfully owed to the security officers who have served at DHS contracted shelters. Security officers at city shelters are frontline workers in some of New York's most challenging workplaces, serving the most vulnerable of our neighbors. The majority of these workers are Black and brown New Yorkers who deserve not only our respect, but fair wages and benefits that reflect their essential role in protecting our community and allowing them to build stable and dignified lives in the city that they help keep safe. Beginning in 2020, 32BJ campaigned for legislation to require prevailing wage benefits for security officers at city contracted shelters, the Safety for Our Shelters Act, sponsored by Councilmember Ayala and Moya, passed in 2021. But contract amendments delayed to lead to officers being owed back pay retroactive to the required start date. Despite 32BJ's sustained effort to understand the cause and the scope of this delinquency, those engagements with agencies and other stakeholders, still to this day, we believe that thousands of officers are owed tens of millions of dollars in retroactive wages and benefits. We are asking the council to allocate no less than $90 million to DHS to fund the back pay due to thousands of workers. These allocations, while representing only a small percentage of the DHS budget, would be life-changing for many of officers who are owed. In closing, I would like to elevate the cascading impact that delayed payments by the city in contracted social service providers have on working people who deserve better with the city they serve every day. Beyond budget season, 32BJ looks forward to working with the council stakeholders to advance reforms that will lead to contracted work at city facilities, including shelter security officers getting the respect they are due. Thank you. Are we on? Here we go.
Good afternoon, everyone. My name is Tammy Murray. I'm 46 years old, and I was born and raised in New York City, and I'm also an Army veteran. I work as a security officer in the city shelter system. I've been working in security for almost 8 years, ever since coming back from the military. On a day-to-day, my job is to keep everything running smoothly. I make sure all my guards, my coworkers show up, and that they're doing their job to keep everyone safe. When things do happen, we're the first responders. If there's a fire in the kitchen or anywhere in the building, we evacuate the building on a need-to-need basis. If there's a fight, we step in and try to de-escalate the situation. It's not easy work, but it's important. And the thing about shelters is that a lot of people don't want to be there. It's true. I know that because I went through the shelter system myself. When I first got out the military and came back to New York, I was in the shelter system with my children. So every time I go to work, I try to make it as smooth of an experience as possible for people coming in. They're in a tough spot. I moved out of the shelter system when I got a job at security. It was huge for me, but still, every month I was scrambling to pay my bills. So when we got the prevailing wage adjustment, it was really a big deal. It would mean my hourly salary nearly doubled, and I could pay all my bills and also help my children and grandchildren more. But then it took several months for me to see the new number hit, as well as others. As a hardworking veteran and mother, I deserve a living wage, and I deserve the pay that I worked almost 3 years of shifts for. Ever since I got out of the military, I've been fighting to get on my feet. Right now, I'm in between jobs. The shelter I worked at, since it was a migrant shelter, had closed, and I've been waiting to be assigned to a new site. That could take probably up to a few months, I don't know. I'm a little behind on my rent and phone bill, but with this money, I can finally catch up. I can pay my bills and make it through this job transition. Most importantly, I can send something to my kids and grandkids. I'm about to be a grandmother of 4. So I urge the City Council to find the back pay rightfully owned to security officers like me, as well as others. Thank you.
Thank you very much. Thank you. Our next panel, we have Emily Paez, Molly Eclector, Abdullah Yunus, Joe Rosenberg. Okay, you could begin.
Thank you. Good afternoon, Chair Ayala, Chair Brandon, and council members Aviles, Banks, Caban, Jose, Restler, Riley, Stevens, and Ugg for taking the time for this hearing and this testimony presented by Hispanic Federation, a nonpartisan organization seeking to empower and advance Hispanic communities to programs and legislative advocacy. Our network of 780 member and partner organizations, over 200 of which are here in New York City, are frontline service providers of our neighborhoods and communities. Despite being significantly undercapitalized and under-resourced, local community-based organizations remain the heart and soul of ever-changing and ever-growing Latino families. They are deeply embedded in our neighborhoods, providing our most vulnerable residents with food, shelter, and clothing, helping at-risk youth succeed academically, low-income families obtain health insurance, and workers gain the skills they need to be more successfully mobile and socially mobile. Additionally, CBOs uplift communities that would otherwise be voiceless to advance equity and opportunities to improve everyone's quality of life. Today, we are taking the time to advocate the expansion of key funds for incoming year to support our ever-growing Latino families to ensure that the city prioritizes the allocation of resources that can improve the well-being of our vulnerable communities. Hispanic Federation is requesting that the City Council provide baseline funding of $100 million to Community Fund Connection, CFC, to allow emergency food providers to battle food insecurities for all New Yorkers. Additionally, as the Council did in 2020, the response to a severe hunger crisis, we request the allocation of $20 million in discretionary fund for emergency funding for food pantries in the fiscal year 2026. New York City budget for Hispanic Federation, as well as our community partners, Met Council, and Catholic Charities. For over 15 years, a cornerstone of Hispanic Federation's La Lucha contra el Hambre hunger relief effort is boosting nutritional food support to needy families across New York City. Filing a need for food items and food pantries have been a hard time fulfilling to improve the health and nutritional status of New Yorkers. Through our network of nonprofit community-based organizations and other partner agencies across New York City, in its surrounding areas, Hispanic Federation worked to provide fresh fruit, produce, and meats that meet culturally responsive and diverse communities across the region. In fiscal year 25, La Lucha contra el Hambre has provided over nearly 350 meals, Thanksgiving turkeys, Christmas pernils, impacting 15,000 families living in New York's most vulnerable communities. On our ground, service providers entrusted among vulnerable Latino communities throughout the city can and certainly to reach those needs. We are grateful for the City Council's commitment to address food insecurities that have felt throughout New York due to economic deficiencies. Additionally, we are thankful for the support that has been provided to our neighbors. One of our underlying basic needs of the overall health and safety of all populations is food security, and it continues to be the most deeply impacted by Latino and Black New Yorkers. According to the 2024 Food by Numbers report by the Mayor's Office for Food and Policy, over 40% of adults in New York City lived in households at risk for food insecurity in 2023, compared to 39% in 2022, continuing a rise trend since the pandemic. The report additionally highlights that the impact of food higher rates, another reason why HF's Hunger Relief Program focuses on providing fresh fruits and vegetables to pantries and communities where these are harder to access. In the face of deepened cuts and once stable federal funding, the need now for New York City to step up to meet the need of our vulnerable neighbors is critically more important now more than ever. We have heard from organizations that have had cuts back in the amount of food offered, as well as a reduction in the number of families that they can serve due to budget cuts. Although appreciative of CFC's funding being maintained at $36.1 million in the executive budget, we anticipate that there is a much larger need faced with uncertain economic times and mass funding from the federal level cuts that are directly impacting communities of color. Hispanic Federation applauds the City Council and calls to $100 million in baseline funding, and we will continue to advocate for funding among the final budget. We thank you for your time, and we look forward to working with you all to help serve New Yorkers to meet the culturally responsive hunger relief assistance programs. Thank you.
Thank you very much. Joe?
Sure. Good afternoon, Chairs Ayala, Brannon, and Brewer. I'm Joe Rosenberg, Director of the Catholic Community Relations Council, representing the Archdiocese of New York and the Diocese of Brooklyn and Queens. Catholic charities of both dioceses have been providing shelter, food, and other essential services to New Yorkers for more than 1 century. Combined, we operate over 80 food pantries throughout the 5 boroughs and serve more than 18 meals annually. We have faced many challenges assisting New Yorkers over the last 100 years, but we are currently confronting a hunger and food insufficiency crisis. This is due to the rising poverty rate of New Yorkers, the dramatic increase in rents and price of food, and even more significantly, the unprecedented federal attacks on programs that protect our clients. 2 of these are SNAP and the Emergency Food and Shelter Program. SNAP provides essential funding to address food insecurity for vulnerable Americans. The proposed congressional reduction of $230 billion from the program is particularly troubling and will have significant consequences by increasing the number of Americans who face hunger on a daily basis. A similar situation exists with the Emergency Food and Shelter Program, a crucial federal resource for our food programs. This was placed on hold by the federal government in March, and as a result, both Catholic charities have sustained a loss of over $800,000 each. We have seen the number of people at pantries increase significantly. We're not just feeding working families, seniors, and children. Newer clients include college students, recent college grads who are either unemployed or underemployed, youth aging out of foster care, and migrants, many with infants. State Controller DiNapoli's report last month on the cost of living reveals that 1 of 9 households in New York are affected by food insecurity. That adds up to over 1.3 million New York City residents going hungry. The plight of children is particularly heartbreaking, with more than 1 in 4 in our city living in poverty. Due to all these obstacles, and with more New Yorkers going hungry every year, we urge $20 million in emergency funding for food pantries be included in the FY26 New York City budget for both Catholic charities, as well as our partners, Met Council and the Hispanic Federation. We also rely on the Community Food Connection, and we strongly support your effort to baseline it at $100 million annually. The mayor's budget has it at 36.1. That is not enough. So our city faces daunting challenges, but one of the most important priorities is that we cannot have our fellow New Yorkers go hungry. We thank you for your long-standing support of our mission in assisting our city's residents.
Thank you.
Good afternoon, Chair Ayala, Chair Brannon, fellow members of the committee. My name is Molly Eckerly, and I'm the Food Policy Associate at the Metropolitan Council on Jewish Poverty. Thank you for holding this hearing today. Met Council operates the largest kosher and halal food pantry network in the country, serving more than 200,000 New Yorkers annually, regardless of religious observance. I want to start today by applauding City Council for calling for $100 million in baseline funding for community food connections in response to the preliminary budget. While the executive budget did not include this amount, and we're grateful that the funding for CFC has been maintained, in this uncertain moment when federal anti-hunger programs are under attack, it's essential that the city step in to fill the gap that federal cuts will leave behind. So today I join our fellow emergency food providers in urgently requesting that the city invest $100 million in CFC and create a special $20 million fund for emergency food. There's an estimated 1.3 million food insecure New Yorkers, and according to a recent New York Health Foundation report, food insufficiency is currently estimated to be higher than it was in 2020. Additionally, 63% of households with children are unable to consistently meet their basic needs, such as food, housing, or health care. CFC is a uniquely valuable program for kosher and halal providers, as it empowers pantries to choose the foods that meet their community's needs by offering a robust selection, including many kosher and halal options that are not available through other funding sources. There's an urgent need for more funding for frontline emergency food providers, and by baseline funding CFC at $100 million, City Council will enable providers who are facing dramatic federal cuts and pauses to battle food insecurity for all New Yorkers. Additionally, in 2020, at the height of need and uncertainty, New York City created a special fund for emergency food. These dollars allowed Met Council and our partners Hispanic Federation and Catholic Charities to deploy resources to areas with limited pantry and social service infrastructure and meet the needs of communities with religiously informed or culturally nuanced diets. With this proven experience and in the face of a hunger crisis that is becoming worse than we saw 5 years ago, we urge City Council to commit $20 million to continue and expand on the important work that we've done. Thank you for your time today, and we hope to continue to work with these committees and City Council to better meet the needs of New Yorkers experiencing food insecurity.
Thank you all very much. Okay, now we have next panel, Kim Mascaratolo, Carolina Cortez Rivera, and Emily Brett.
Okay. Hello. Thank you so much for having this hearing, Chair Ayala and Chair Brannon, as well as Councilmember Brewer and all the members of the committees. My name is Kim Mascaratolo. I'm the State Policy Director for Hunger Free America. I've testified in front of the General Welfare Committee several times in the past few months, talking about the massive hunger crisis in New York City. I want to thank all of my fellow advocates who were here advocating for the baseline funding for CFC, which of course we agree with, and they've given you all the statistics on hunger in New York City, so I don't need to repeat all of that. I will say that this week the House Agriculture Committee passed a portion of the broader budget package that would slash U.S. domestic food assistance by $300 billion. The cuts to SNAP alone would reduce benefits for all 41 million participants in the program, and so I think it's more important than ever that the City Council really needs to step up in terms of funding programs that will help people who are hungry and help people who are facing poverty. Nearly 1 out of every 5 children in New York City experiences food insecurity, and at the same time, there are hundreds of thousands of city residents eligible for federally funded benefits who do not receive them. And so in terms of what we believe the city can do to most effectively fight this, first and foremost, increasing funding to nonprofit groups that increase access to government food benefits through the NYC Benefits Program and direct City Council funding, accelerate the city's promised work to create a My City portal that would allow people to apply for benefits, multiple benefits at the same time. We want to make sure that all classes in New York City public schools provide either in-classroom school breakfast or grab-and-go breakfast. We want to make sure that you work with nonprofit groups to launch a comprehensive outreach and enrollment campaign to ensure robust participation in the new summer EBT program. We hope that you will take all or some of these actions rapidly. We still believe that the best way to combat hunger is to connect people with the federal benefits they are eligible for. We also think this will help as we are facing budget cuts everywhere. Making sure that people are connected to those federal benefits, that's hopefully less funding that the City Council will have to provide directly to them. So we thank you for your time, and we hope you'll commit to some of these programs.
Thank you, Kim.
Hi, thank you to General Welfare Committee Chair Diana Ayala for holding today's budget hearing and the opportunity to submit this testimony. My name is Carolina Cortez Rivera, and I'm here today as a Washington Heights constituent and anti-hunger advocate. I serve as the Digital Food Choice Program Manager at the West Side Campaign Against Hunger, known as WISCA, which for 46 years has worked to increase access to healthy foods, fresh produce, and connect New Yorkers in need with benefits enrollment. In 2024, I helped over 2,000 customers receive groceries delivered directly to their homes, a distribution channel we're using to expand our vision of food access and choice. Last year, WISCA provided 5 million pounds of food to over 110,000 New Yorkers. More than 50% was fresh produce. Our digital choice platform gives customers the options to select their grocery box type online, and soon will let customers choose a pickup location closer to home. Folks shouldn't have to endure long commutes to obtain their groceries, so we're working to address the accessibility gap by giving back a critical resource to our customers, time, especially given that many of them work long hours or have families to care for. Choice is more than just choosing food items. It's also about where and when customers access their groceries, free of stigma. Our home delivery program reaches patients experiencing food insecurity, specifically pregnant people, families with young children, and older adults, many of whom live with chronic mobility issues. Reliable access to healthy foods has clinical and preventative health benefits. Every New Yorker deserves that. None of this work is possible without the city's financial support. Programs like Community Food Connections are critical in achieving food security in our city and help frontline providers like WISCA keep our pantries stocked with market-quality fresh produce for our communities. But we're struggling. In a time where both housing and food insecurity are reaching another record high, we've had to, for the first time, turn away new customers at our in-person pantry on West 86th Street on the Upper West Side. The need in our city is indisputable, and access to nutritious food is fundamental to a dignified life. Yet we're facing unjustifiable budget cuts to the very programs that help us innovatively increase food access and promote food as medicine. So although last week the mayor proposed $31 million again for CFC funding in the year ahead, we know this is not nearly enough, and we ask that the FY26 New York City budget increase baseline funding to a total of $100 million for Community Food Connections, formerly known as EFAB. CFC funding helps emergency food providers like WISCA purchase fresh, high-quality food for our communities. Despite us implementing cost-saving solutions through coalition-building initiatives like the Roundtable, we still need the city's support to ensure our communities are healthy and nourished. Last year, the Roundtable served 69 million meals across 882 distribution points and saved over $200,000 in bulk purchasing through collective action. Imagine the reach and impact we could have with the city's increased financial support. Thank you for your time and leadership, and I'm hopeful that you can bolster the Community Food Connections program to the needed levels, and we're grateful for your continued support and leadership. Thank you.
Thank you very much. Okay, next panel, we have Abdullah Yunus, Catherine Trapani, Agnes Kim, Mark Papish, and Constant Lasole. You could start.
Thank you, Chair. I appreciate it. I'm Catherine Trapani. I'm with Volunteers of America, Greater New York, and we are one of the largest supportive housing and homeless services providers in New York City. And I'm here today with gratitude to your work and to Chair, Deputy Speaker Ayala and Gail Brewer and all the other members of the council to just sort of talk through what has to happen with the homeless services safety net so that we can weather the storm for the next year. I spoke with you at a rally recently about the late payment crisis. I am depressed to say that VOA is still owed $32 million, and of the 51 returnable grant fund loans that we've put in, 4 have been approved so far. So it's not the solution that the city sort of touted at the last hearing on this matter. So, a budget priority would be to ensure the returnable grant fund functions as described and can really ensure cash flow. I also just want to take a minute to talk about the need to support students in temporary housing across New York City. The homeless crisis continues to be in a bad place, and a lot of children are going to, start school next year without the supplies they need to start the day. And that's because the Department of Education has yet to commit to funding Operation Backpack, which gives students in temporary housing access to the supplies they need before the first day of school so they can walk in the door and be fully prepared to succeed. And so our ask would be a $500,000 contribution from the DOE to Operation Backpack. I'm grateful for the council for including the $250 in your budget response, but if we can nudge that number a little bit higher in the final, I think that would go a long way. Finally, I want to talk about the need to invest in proven housing solutions. We're grateful for the investment in the HRA indirect funding, which is going to shore up the infrastructure for supportive housing. I'm grateful for the shift from the scattered to the congregate model to ensure that we have enough housing to meet the need. But finally, I do just want to say that the City FEP's budget continues to concern me. There is this sort of Trojan horse of a rule change coming through where there's going to be a rent hike for long-term City FEP's participants that will impact roughly 25% of the population. So we hope that the council pushes back against that and really ensures that City FEPS is fully funded for all voucher holders, both for today and for tomorrow. And my written remarks certainly contain a lot more detail, but just really, thank you for your ongoing advocacy and support of the sector.
Oh, hello, sorry. Hello, my name is Agnes Kim, and I'm testifying today on behalf of the Family Homelessness Coalition, or FHC. FHC is made up of organizations representing service and housing providers, children's advocacy organizations, and people with lived experience with family homelessness. We're united by the goal of preventing family homelessness, improving the well-being of children and families in shelter, and supporting the long-term stability of families with children who leave shelter. Thank you to the chairs and members of the committees for the opportunity to testify. While we were pleased to see $176.6 million in the executive budget dedicated to city FEPs, we are greatly concerned about the proposed HRA rule to increase some recipients' portion of rent from 30% to 40%. While rents in New York City continue to increase sharply, incomes have not. The cost of rent has been rising faster than income, further widening the gap in recent years. While we understand the need to control costs in an uncertain federal and budgetary environment, this change is not the way to do so. This is a critical moment for the city to commit sufficient resources to support families in need. Given the federal landscape, the city should do all in its power to mitigate the impacts of looming federal cuts to housing programs, social services, Medicaid, and other social safety net programs. FHC continues to strongly urge the following priorities in the upcoming budget. Finding a housing stability solution for the emergency housing voucher recipients. FHC is deeply troubled by the planned end for the EHV vouchers, which house around 16,000 families. There's a looming crisis of homelessness, there's a looming crisis of homelessness if a solution is not found for these families. While federal advocacy efforts continue, we urge all stakeholders to come together with a plan. Additionally, increasing the budget for Home Base by $37.9 million to a total of $100 million for eviction and aftercare services and improve housing stabilities for low-income households. We also support $4 million in additional funding for the City Commission on Human Rights to enforce source of income discrimination, amongst other priorities which we've outlined in the submitted written testimony as well. On behalf of FHC, thank you again.
Thank you, Deputy Speaker Ayala and Chair Brandon, for the opportunity to speak today, and as well as Councilmember Brewer. My name is Mark Papish. I'm the Supervisor of Government and Community Affairs at the Center for Family Representation, also known as CFR. CFR is the assigned countywide indigent presence provider providing interdisciplinary legal services to families facing ACS and investigations and prosecutions in Manhattan, Queens, Staten Island, and parts of the Bronx. In the last fiscal year alone, we served thousands of clients, many of whom could have been your constituents, particularly yours, Deputy Speaker Ayala. Over 90% of our clients are Black, brown, or people of color. All of our clients are victims of poverty, as we would say. We also provide youth representation in parts of Manhattan, Queens, and the Bronx. But I'm actually not here today to speak about our family defense model, but rather our complementary services, which are in desperate need of support from legal services for the working poor and legal services for low-income New Yorkers. As many of you know, coordination of services is a critical aspect of any functioning social safety net, in particular when that causes coordination between various legal service and social services organizations. At CFR, we are thrilled to have the Home for Good unit. What this means is that when clients come to us facing ACS investigations, they're coming to us with usually a number of other issues, including landlord-tenant issues, including immigration issues, including issues navigating the social safety net. What Home for Good allows us to do is to be a one-stop shop for all those issues. You come in with an ACS issue, but you also have a non-payment case, we'll take care of it. And we're incredibly proud of this. And my apologies, I'm being a little nervous. It's very wet outside and it kind of ruined my notes. But all that to say, getting to the ask, we're asking for $425,000 for our Home for Good program, which offers holistic support for parents and youth, in addition to $150,000 in DOVE services to continue our deep support for victims of victims of DV. Thank you for your time, and I'll be better next time.
Thank you.
Good afternoon, Chairs Brannon, Ayala, and Councilmember Brewer. My name is Abdullah Yunus. I'm Vice President of Advocacy and Government Relations at United Way of New York City. I'm here today to express strong support for expanded funding for the Community Food Connections program that you've heard a lot about today. In this year's budget, we want to call for the FY26 budget to implement the City Council's own vision and recommendation of $100 million in baseline funding for this program, which was not addressed in the Mayor's executive budget. Community Food Connections is a proactive approach to building resilient food infrastructure. It emphasizes dignity, neighborhood trust, and access to nutritious, culturally appropriate food. It acknowledges that our emergency food systems were never actually intended to be permanent fixtures. However, for many New Yorkers, they've become exactly that. At United Way, we collaborate with over 400 community-based organizations across all 5 boroughs and serve around tens of thousands of New Yorkers weekly. In the wake of COVID, food insecurity remains alarmingly high. Visits to food pantries are up 85% since 2019 and have not gone down. Worse, we've already begun to see pauses in federal programs, such as the Emergency Food and Shelter Program, which currently owes $1.25 million to 97 local CBOs. CFC offers a solution. It provides predictable funding, enabling local organizations to plan effectively. It shifts our approach from reactive to systemic, fostering a food system that is equitable and sustainable. We know this model works because we've seen its impact firsthand. With sustained and enhanced support, CFC can serve as a blueprint for effective public-private collaboration when it comes to food access. New Yorkers are counting on us. No one should have to choose between paying rent and putting food on the table. We urge New York City Council to prioritize fully funding this program with $100 million and demonstrating leadership and compassion that this moment demands. Thank you for your commitment to building a more just and food-secure city.
Thank you. Thank you all very much. Constance?
My name is Constance Lasold, and I just want to make a few comments on the importance in a democratic society of voting. And it seems to me that with all you've talked about today, which is so overwhelming, the difficulties, particularly in the shelter systems, but in all of them, it is very important that you have money in the budget to encourage voting. Maybe you do. I'm sorry if I am wrong in suspecting that you don't have money in the budget specifically for the shelters, jails, mental hospitals, whatever. I do know that out at Creedmoor, only one person voted in the last election. In the part of Creedmoor that is there because there's not enough housing. Those people are free to come and go as they please. Only one person voted. It is very, very important that you get the League of Women Voters and any other groups that you can to get into the shelters and other such places and get permission to get in and register voters. This is not an appeal to register them for any particular party or whatever, but we can't have a democratic society if people are not voting, and they're not. It's part of why we're in the problem we're in right now. I also am very concerned about any mandatory work programs. Well, we've tried those over and over. They don't work. Things aren't getting better. We have more and more people homeless, and the cost of living goes up and up and up. It is not fair when we give these big tax breaks to developers that we are asking people who are in great need and under great stress to participate in mandatory work programs. So even if the federal government demands them, I hope you will resist cooperating with these kinds of programs that have not worked in the past and won't work now. And involuntary commitment comes in the category of those kinds of programs that don't really work.
Thank you very much. Thank you all. Okay, our next panel, Stephanie Mansfield, Gabriela Sandoval Requena, and Stephanie Woodbine, I'm sorry.
Richard Flores.
You can begin.
Thank you so much. Good afternoon, Deputy Speaker Ayala and Chair Brannan and Council Central staff. Thank you for holding this hearing and for the opportunity to testify on behalf of New Destiny Housing. My name is Gabriela Sandoval Requena, and I am the Vice President of External Affairs for New Destiny Housing. New Destiny is the only organization in New York that's 100% focused on permanent housing solutions for domestic violence survivors. We do this work because domestic violence is the #1 cause of family homelessness in New York City. Access to a safe and affordable home often determines survivors' ability to leave their abuser for good and stay alive. As the federal government continues to threaten vital housing programs for survivors, this year, more than ever, we need our city leaders to step up and protect New Yorkers impacted by domestic violence and homelessness. We are submitted extended written testimony, so I'm just going to focus on our 3 priorities here. Number 1, we ask the City Council to urge members of Congress to fund the Federal Emergency Housing Voucher Program. The federal government notified agencies in March that funding for the program is ending this year. Nearly 8,000 households in our city depend on this vital resource, including almost 1,700 domestic violence survivors. New Destiny helped house more than half of these survivors, and since we maintain close contact through our aftercare services with them, we know how vulnerable many of them are to return to homelessness or their abuser if they were to lose the vouchers. Number 2, we ask the Council to ensure that HRA, HPD, NYCHA are planning for contingencies to support any loss of VHVs, including increased funding for city FEPs and opposing the proposed income changes to the program. And number 3, the 2026 budget must include $6 million for NGBV's flexible funding program for domestic violence survivors. We thank the Council for passing legislation that created this program back in 2022. The flexible funding program was finally implemented last year as part of, just a few more minutes, as part of the existing Home Plus initiative. However, the $1.2 million allocated in the budget has proven to be insufficient, and we understand that by now the funding actually has run out. Thank you, and I'm happy to answer any questions.
Good afternoon. Thank you, Deputy Speaker Ayala and Chair Brannan, for the opportunity to comment on the executive budget. My name is Stephanie Woodbine. I am a domestic violence survivor and a member of New Destiny Housing's Survivor Voice Project. I'm also a resource coordinator at New Destiny, serving around 40 domestic violence survivors as their case manager while they rebuild their lives after fleeing abuse and being rehomed. I'm asking the city to fund the flexible funding program to $6 million. Now more than ever, flex grants are important because they save lives. My clients benefit from these grants to get necessary essential items. Imagine leaving everything and grabbing your baby in the middle of the night, and then imagine if you manage to keep your memories, losing them in a storage auction after 5 days' notice. That is the reality of survivorship, and it's these situations that flex grants come in necessary. The program was funded at 1/3 of what we need. This impacted its rollout negatively in that there wasn't enough to pay dedicated staff, which accounted for high turnovers. This meant most survivors who needed grants were left in the cold with little to no information of what's to come next. With an average of 28 days for processing applications at the one agency, Womankind, who rolled out the program in October of 2024. We also need an expansion of housing resources for survivors. They have nowhere to go when they flee abuse. And the few programs like ours that help are threatened by federal cuts. My clients are afraid. Also, regarding this new rule proposed by the Adams administration to increase rent from 30% of income to 40% is reminiscent of systemic oppression. An increase in income towards rent will destabilize families who are low income and are rebuilding lives. It's almost a punishment to these New Yorkers, most of which don't have other benefits to balance out an increase in their rents. Food pantries are not enough, and they are overburdened as is. Something has to give. Thank you.
Thank you.
Hi. Good afternoon. It's been a long day. It's raining now. It was a pretty sunny and gloomy day. I appreciate your time. My name is Stephanie Mansfield, Stephanie M. I'm a single mom of 3. I just want to take 2 seconds to acknowledge all that we accomplished here today. There was the Catholic kids that came in and saw us. There was the union members that came and showed the unity. There was many, many, many moments of frustration and just overall clarity and just frustration on my end. I'm a single mom from Brooklyn. I have 3 children. I am disabled. I'm so off script. What I wanted to say to you guys is irrelevant to what I heard today. I am a EHV voucher holder. There's something that the DSS commissioner said today. She said homelessness and people on the street have been failed. And what I wanted to respond back is to say that the lack of proper and adequate support is what failed those homeless people, unhoused people. I was housed and unsupported as a survivor. I was unseen and unheard in my survivalness. My children, I have a son that is neurodivergent. I have another son that has ADHD hyperactivity, undiagnosed for a very long time. Is because of the lack of support. And being a mother that is also suffering and have a disability, unseen disability, it is hard to reach my full potential in life without the proper support. So as we are sitting here and we're trying to count the pennies and see how we can distribute money to really impact homelessness. I am a mom of 3 trying to curate and trying to make sure that my kids can be that astronaut, can be that writer, can be that soccer player. I have to make sure that this cycle ends with me, that being a voucher holder ends with me, that they can be the best that they can be. I don't have that village. I'm relying on these services. So I'm here to advocate for that. I am symptomatic, I am sick, I'm disabled, and I'm advocating for that here today. So hearing these things and sitting here and just being like, okay, I'm cool, this is great. This is why I'm here. I should have been here last month. I should have been here in so many hearings before me, but just having the pleasure of being able to be here. I was in the hospital in March. I'm over my time, I'm sorry. I was in the hospital in March, and I was hospitalized for a very long time, and I still had to make sure that my kids were okay. My ask from you guys is to push for the FEPS, to make sure that the funding in FEPS is met, to make sure that HRA, that DSS, that those things that are meant for not only survivors, but also for homeless, that we have access to that care. There's like this lack of continuity. So a lot of things that I was hearing today is like this discontinuation of care. It's like DSS was saying that they have police officers. This morning, I'm in my safe space. I'm in my safe home, and I see a homeless person, and I see how they have mental health illness, but there's a DSS officer that can address that mental health illness specifically for that person, right? But does the local precinct know that? Does Does HRA know that? How do we hold these systems accountable? How do we get them to communicate with one another and work in a way that the layman, like myself, who's just trying to survive, can access these things and thrive? So, thank you.
Thank you all very much. Thank you. Okay, we have Patricia Wong, Leslie Thrope, Siobhan Small, Brian Fritsch, Abby Bieberman, and Raquel Manouche. Okay, you want to start from my right, your left?
Sure. Thank you. Good afternoon. Got it. Thank you. Good afternoon, everyone. Good afternoon, Chairs Ayala and Brennan, Member Brewer, and Council staff. My name is Siobhan Small, and I serve as the Executive Director of Legal Services NYC. Thank you for the opportunity to speak today about the crucial role legal services play in reducing poverty, preventing homelessness, and keeping New York families safe and stable. At Legal Services NYC, the largest provider of civil legal services in the country, we serve more than 100,000 New Yorkers. But we are not only a legal services provider, we're an anti-homelessness prevention organization and anti-poverty organization. Our work helps people stay in their homes, access health care and food, maintain financial security, fight back against discrimination and exploitation, and secure the necessities of life. And we do all of this while saving the city hundreds of millions of dollars. Last year alone, our eviction prevention program and benefits saved the city over $300 million in averted shelter costs, representing a nearly 10-to-1 return on investment. Meanwhile, the nonprofit sector that delivers these services is being pushed to the brink. Contracting and reimbursement delays have led providers, including Lisney, waiting 6 to 10 months or more for payments. We've had to draw down credit lines just to meet payroll. No nonprofit, no matter how mission-oriented, can survive this way. No nonprofit can survive with the city owing them tens of millions of dollars day in, day out, year in, year out. And if one of us falters, even if one of us on this group falters, one of us in the city falters, it has a ripple effect that impacts the entire system. We're also staring down a federal financial cliff with core programs at risk. If the city experiences federal funding cuts, it may be tempted to scale back or eliminate crucial programs like eviction prevention, tenant harassment protection, immigrant legal services, and public benefits advocacy. But let's be clear, cutting these services won't save money. It will cost the city more. Our programs are not just social supports, they are cost-saving interventions that prevent homelessness, reduce reliance on emergency services, and keep families stable and out of crisis. More New Yorkers rely on us every single year, and we keep people out of shelters, out of hospitals, and other costly systems of last resort. The data is clear. Investing in civil legal services up front avoids significantly greater costs down the road. While when families are evicted, they end up in shelters. When immigrants can't work legally, they rely more on public benefits. Again, investing in civil legal services is a great bet, and the city cannot go wrong with increasing the funding and paying us on time and relying on the services that we continue to provide day in and day out for the city of New York. Thank you.
Thank you, Chairs Brennan and Ayala, and to the members of the New York City Council and their staff for your long-standing support of the Legal Services for the Working Poor Coalition. My name is Leslie Thrope, and I serve as the Executive Director of Housing Conservation Coordinators, one of 5 members organizations of this Working Poor Coalition. Alongside HCC, the coalition includes CAMBA, Mobilization for Justice, Northern Manhattan Improvement Corporation, and Take Root Justice. For over 20 years, with the steadfast support of City Council, this coalition has worked to address the civil legal needs of working poor and other low-income New Yorkers, individuals whose income slightly exceeds the threshold for traditional free legal services. The Working Poor Initiative is vital to preserving the economic stability and independence of these New Yorkers. It allocated $455,000 to each coalition partner in fiscal year 25, and this year we are requesting an increase to $600,000 per year for the organizations. That's a full restitution of last year's funding and an enhancement to meet the growing demand and increasing challenges that we face. This increased investment will allow coalition members to increase and expand our services to our communities, including immigration services, workers' rights services, access to public benefits, and economic justice. These services are more critical than ever as federal policy changes and budget cuts continue to erode the social safety net for working New Yorkers. Every day, our organizations work with clients who face civil legal crises that threaten their livelihoods and their homes. These include wage theft and unpaid labor, identity theft, frozen bank accounts, denial of public benefits, consumer and foreclosure issues that jeopardize their housing stability. Without legal assistance, these issues often push working individuals and families into poverty. In conclusion, the Council's investment in the legal services for the working poor remains the only funding stream specifically dedicated to addressing the civil legal needs of working people in New York City. We urge you to not only continue this flexible essential funding, but to increase it. We thank you for your time and your continued support.
Good afternoon, Chairs Ayala and Brennan, and members of the committees, which I don't know where they are, but thanks to them as well. My name is Raquel Namuchin. I'm a tenant advocate and community outreach specialist at Mobilization for Justice. I'm also a proud member of MFJ's staff union, AILA UAW Local 2325. Mobilization for Justice has been providing free legal services for over 60 years to low-income individuals, and we pair that work with community advocacy, education, impact litigation that brings relief to many people that need it the most. And so I'm here today to talk to you about the need to fully fund and enhance legal services for the working poor, the Immigrant Opportunity Initiative, and all the other vital legal service programs so many New Yorkers depend on. So every year, MFJ's dedicated staff of paralegals, organizers, social workers, and attorneys handles approximately 14,000 cases from across New York City in the broad areas of housing, disability and aging rights, economic justice, and children's rights. And we're providing these legal services to working class communities in the context, as you all know, of a federal administration that is openly hostile to the ideals of public service and the public good. The other difficulty comes in the severe delays, as others have already mentioned, that the nonprofit community faces in contract payments and hiring obstacles amidst the challenges of pay parity for public service work. And though it's been a tough year, we know it has been even a tougher year for our clients. And so our goal is to be the strongest advocates and allies we can possibly be, but doing so, of course, requires resources. So last month, I assisted a family living in an illegal basement apartment to obtain emergency housing relocation services. This was really tough. The family had a 1-year-old baby for 2 weeks. The baby couldn't have access to her bottles, her baby seat, her food, and other necessary items. And so it's for these clients that I strongly urge the council to fully fund and enhance these following initiatives: legal services for the working poor, family advocacy and guardianship support, the Immigrant Opportunity Initiative, legal services for low-income immigrants, low-wage worker support, and the new Protect NYC Families initiative. For MFJ, some of our most critical programs, such as our immigrant practice and our kinship caregiver law project, council actually fully funds these programs, or this is where we get the main support from, financial support from. And so without this support, we can't continue the robust services that we offer. So for kinship care in particular, this is actually the most crucial, as we are the only New York City provider of free legal services for grandparents, parents, aunts, uncles, and other kin caring for their children who reside outside of the foster care system. And so as New Yorkers, we know that immigrants are who make our neighborhoods the vibrant communities that we all love. And so now is the time to demonstrate that we will stand with our neighbors. And so I, again, respectfully ask that you favorably consider our funding request, and I thank you for your time. Thank you.
Thank you.
Good afternoon, Chair Brennan and Deputy Speaker Ayala. I'm Brian Fritsch, Associate Director of the Permanent Citizens Advisory Committee to the MTA PCAC. We are incredibly disappointed that Mayor Adams once again refused to expand the Fair Fares program to 200% of the federal poverty level in his executive budget. The mayor spoke at length in his address about making New York City more affordable for working class people, but at $22,000 for an individual or just over $45,000 for a family of four, nearly all working people make too much to qualify for the program. Raising fair fares to 200% would expand eligibility to over 415,000 residents, including 160,000 regular commuters and minimum wage New Yorkers who are incredibly likely to be transit dependent. It's critical we do this now, before MTA fare increases, which are scheduled to take place later this summer, making the subways and buses more expensive for everyone. On top of this, New York City is the least generous major U.S. city that offers a public transit discount for low-income residents, despite having one of the highest costs of living and the highest poverty rates. Nearly all other U.S. cities use 200% as their income limit, and most also offer discounts on their commuter rail systems, which New York City does not do. It's time to change that too, so people who live in subway deserts but are close to the Long Island Railroad or Metro North within the city can use their fair fares benefits on whichever system is most convenient for them. Yet what's perhaps most frustrating about the program is that due to its dismally low enrollment rate, it's feasible for the city to raise the eligibility threshold while maintaining the current funding level and still end the year with money in the bank. It's time to stop kicking the can down the road on this program and expand fair fares to 200%. I don't think anyone wants to go through another year where it takes HRA 6 months to implement another 20% change. Working people deserve a half-price ride. They won't qualify unless we raise the income level. Thank you to the Council, and especially Speaker Adams, for your steadfast commitment to this program. Let's expand fair fares now.
Thank you.
Deputy Speaker Ayala, Chair Brannon, and staff, thank you for the opportunity to testify about the FY26 budget. My name is Abby Bieberman, and I'm the Associate Director of the Public Benefits Unit at the New York Legal Assistance Group. In a political climate where access to SNAP and Medicaid benefits are on the chopping block, and where the intention is to create more barriers or eliminate access to these benefits, the city must provide the highest level of care to New Yorkers in need. Our clients still encounter problems completing their applications and recertifications because of systems at HRA that are not functioning well or not accessible, and these barriers are leading to improper denials. Although we are pleased with the recent improvement in timeliness, we are still concerned that many of our clients are still waiting too long for cash assistance that they need for their families. And these delays also put our clients up against housing court deadlines and dangerously close to eviction. Failure to maintain these systems for recertifying and applying for benefits causes administrative churn, and it leads clients to losing their subsistence benefits and to have to submit multiple applications before they are accepted. In addition, NYLAG opposes the city's harmful changes to the CityFEPS program that will result in a higher rent obligation for recipients, in conflict with the principle that no family should have to pay more than 30% of their income toward rent. This will impact low-wage working families who are on CityFEPS, who already struggle to pay the 30% required under the current program. Increasing their obligation to 40% will result in more eviction cases. NYLAG also has extensive initiative requests for the following, including legal services for low-income New Yorkers, Immigrant Opportunities Initiative, Immigrant Health Initiative, low-wage worker support, legal services for veterans, legal services for low-income immigrants, and estate planning and resolution. These are all fleshed out in my written testimony, and thank you very much. We look forward to our continued work together.
Good afternoon, Chair Brennan and Deputy Speaker Ayala and members of the Council. My name is Patricia Wong. I'm here on behalf of New York Lawyers for Public Interest, also known as NLP. I would like to thank you all for this opportunity to testify. NLP is a community-driven legal organization working in the areas of civil rights and health, disability, immigrant, and environmental justice. I'm here to raise before the Council urgent issues affecting our client communities. To begin, NOPI's health justice practice works to bring an equity and immigrant justice focus to health and advocacy. We continue to find that due to HRA understaffing, our clients experience unnecessary delays and systemic barriers to enrolling in urgently needed health insurance. Bureaucratic inefficiencies and understaffing have routinely caused delays lasting weeks or months and led to wrongful denials for otherwise eligible individuals. These issues leave vulnerable people without essential resources and benefits and result in severe consequences. We ask the Council to ensure that HRA is adequately staffed and funded to meet the needs of New Yorkers. I'm also here to raise before the Council a critical need for resources to help nonprofits in the city, especially for those organizations responding to politicized threats and to prepare to face scrutiny under this current federal administration. In New York City, many nonprofits operate with limited resources and are unprepared for legal challenges that could disrupt their work. NOPI is building upon our existing work focused on strengthening and protecting the city's nonprofit sector with the launch of the Nonprofit Resiliency Network. This network specifically focuses on rapid response and risk mitigation for nonprofits facing politicized legal threats. NOPI is supporting organizations that are currently the direct targets of federal agencies. We are standing up against those attempting to conduct raids, chill advocacy, and claw back funding for vital services. Central to this effort is our work providing informational resources, hosting events and workshops, facilitating limited scope consultations, and legal representation. We respectfully request the Council's support with a grant of $200,000 for fiscal year 2026. This will allow NOPI to support 600 to 800 organizations across the city. Lastly, NOPI is privileged to be a part of the City Council's Immigrant Health Initiative, and we thank you for that support. This initiative has supported NOPI's programs aimed at improving the health and well-being of immigrant New Yorkers. We are respectfully asking the Council to restore and enhance the funding for the Immigrant Health Initiative, and we seek an allocation of $650,000 for the fiscal year of 2026. Thank you again for your time, and we will submit a more detailed testimony following the hearing. Thank you.
Thank you. Thank you to this panel. The next panel is Navdeep Bains, Tanya Matos, and Richard William. Okay, you may begin. Yeah, thank you.
Okay, thank you, Deputy Speaker Ayala and the Committee on General Welfare, and Chair Brannan and the Committee on Finance for holding this hearing and for giving us the opportunity to testify. I'm Navdeep Bains. I'm the Associate Director of Advocacy and Policy at the Asian American Federation, where we proudly represent the collective voice of more than 70 member nonprofits that serve 1.5 million Asian New Yorkers. Food insecurity in New York's Asian community has reached a breaking point. A combination of federal funding cuts, escalating anti-immigrant policies, community fears of jeopardizing their immigration status because of public charge concerns, and of course, wild shifts in the economy from the price of food to looming tariffs has created an untenable situation. Despite the model minority stereotypes surrounding Asian Americans, the most vulnerable in our community face significant hardship. 1 in 3 Asian residents live in low-income households, and we are twice as likely to experience poverty compared to white New Yorkers. Furthermore, 42% of Asian older adults are low income, making them among the city's poorest seniors. Many of our member organizations rely on a combination of federal, state, and city resources to feed our vulnerable community members. In these spaces where demand is increasing, organizations are having to stretch their limited resources to keep people fed. In recent years, our member organizations have also seen a disturbing increase in EBT food benefits theft, and this issue is regularly brought to our member organizations, nonprofits working on the ground, to provide support, as many people in our community have limited English language proficiency and limited digital literacy. In an environment where our communities are surrounded by misinformation, fear, and isolation, AAF believes it is more critical than ever that the city reinforce its support for addressing food insecurity by supporting the CBOs that provide these services. We have several recommendations, which is continue elevating the need for an urgent rollout of chip-enabled EBT benefits cards, because no New Yorker should go hungry due to preventable theft. The city should continue funding a network of linguistically and culturally competent food service programs that provide alternative food benefits to immigrants. The city must also remain vigilant and committed to keeping our community's data safe, ensure that non-local law enforcement are not permitted into sensitive locations, because we know that going in person to get services like food pantry or even just getting any government services is something our community is increasingly afraid of giving the information over and of going in person. And we must continue to have a direct line of communication between HRA and our local CBOs, because our local CBOs are regularly troubleshooting benefits issues on the ground with in-language support and providing culturally competent care. The challenges before us are complex, and we recognize there's no easy answer. Your leadership in addressing food insecurity at this vital time is incredibly important, and thank you so much for your work and leadership.
I'm sorry, I just want to call up one more person. Emily Paez? You may begin. Wait.
Emily Brett, thank you so much.
Good afternoon, Chair and members of the committee. My name is Tania Matos. I'm the Executive Director of Unlocal. Unlocal is a nonprofit providing free immigration legal services to New Yorkers. I'm here today to ask you for your support in preserving funding for our immigration legal services, including critical initiatives like the Pro Se Plus project, the Rapid Response Legal Collaborative, and also Unlocal's work with the New York State DREAM Act. The Pro Se Plus project is a collaborative between Unlocal, NILAC, Central American Legal Assistance Group, Catholic Migration Services, MASA, African Communities Together, and Venezuelans Immigrants Aid. This program is a lifeline for people who must represent themselves in immigration court alone. Often because of there aren't enough immigration attorneys to meet the overwhelming need. The Pro Se Plus project was created to give these individuals the tools, guidance, legal screenings, and help complete filings and improving their chances of staying safely in the country with support in their court immigration hearings. It's an efficient, cost-effective way to provide meaningful support to more New Yorkers. Just last year alone, our organization served thousands of clients and their families, many of whom which would have otherwise faced deportation or family separation without this vital help. Cuts to these programs would mean more people go fully unrepresented without any guidance, and where outcomes are drastically worse, as we're seeing day by day. So I thank you for your support, for your continued support for the immigrant community, and really invite you to invest and defend the Pro Se Plus project that we have going on here. Thank you so much, and thank you again for your commitment to the immigrant community.
Hi, my name is Emily Brett. Thank you to the City Council for this time today and for your persistence over 5 hours of testimony. I'm the director of the Greenpoint Hunger Program under Executive Director Ann Cansfield, and I'm here today to ask for the restoration of CFC's full $100 million for the next fiscal year. I know many of you already hold this opinion as well, but I'm here to preach to the choir on the record and encourage your continued aggressive advocacy. Our lines are not as long as they were in 2024. They are longer, and it does not make sense to duplicate a budget when we are no longer facing duplicate circumstances. Our pantry has faced a 125% increase in clients, and those numbers continue to rise. Guests express to me that their need is growing and that they're anxious for what's to come. We cannot continue to rely on the same amount of funding when we do not have the same number of guests. Yesterday at my pantry, we saw over 100 guests, several of them families with young children. Hunger is not just about nutrition. It's about mental health. It's about dignity. It's about the knowledge that someone in your community, whether it's a parent or a teacher or a member of your city council, cares about you and wants you to be here. And to that end, I would express to this council that a denial of CFC's full $100 million funding is a choice to allow hunger into our city, a choice that doesn't just make New York a worse, less livable city, but makes it more dangerous. A fed child is a child who can focus, who can learn, who can go to school, and who can play. A hungry child or a hungry person is in danger not just physically but mentally. They're at risk for depression, anxiety, substance abuse, suicidality, and violence. Hunger is not just a physical sensation, but it is a destabilizing threat that can undo communities, families, and individuals. To briefly zoom out on the large scheme of this best budget, the choice to give CFC its $100 million share while giving the choice not to give CFC its $100 million share while giving the NYPD over $3 billion isn't just an act of absurdity, it's an act of hypocrisy. Guns and tasers on the subway do not make our kids safer. Food on the table makes our kids safer. Please expand this budget to give pantries what we need to do our essential work. If you want to keep New York safe, please keep New Yorkers fed. Thank you for your time.
Thanks for giving me the opportunity to speak, Ms. Ayala and Mr. Brennan. There's one crucial thing that hasn't been said or addressed at this general welfare budget meeting for 2025, and that is, despite what Ms. Parks said, there's widespread racism and discrimination in the DHS and DSS agencies, and it's been targeted at heterosexual and cisgender persons. I have only been to one housing interview in over 3 years as a resident at the BRC facility. And this is after meetings with case managers, with outreach management, with meeting the ombudsman at DHS repeatedly for over 3 years. Ms. Parks said publicly that a shelter facility may remove a person from the facility after that person has seen reasonable housing opportunities. As I said, I've only seen one interview in over 3 years at one resident outside of that facility by the case manager. One. And also that they would be put out of the shelter or facility if they were unwilling to pay the 30% of their income, whether that's from SSD, SSI, or Social Security. Now, if you examine this one example, and there are many other examples and many other scenarios which are not being addressed at the budget proposal hearing, if you just look at that one example, you'll find that there are gaps and problems in the system that's not being addressed. And finally, while the emphasis on this general welfare meeting is on how the budget for DHS and DSS is being addressed by the city and the state for the fiscal year of 2025, please let me state here that the reality of how the budget is being used is in total contradiction to what is being experienced by individuals who are formerly homeless, whether they are suffering from mental illnesses, are suffering from drug or alcohol addiction, or formerly incarcerated, or even worse, if they're targeted for their gender, for their race, for their age, for their nationality, or their religion. The DHS and DSS and HRA must put more emphasis on future planning for how future budgets will be used for the most vulnerable persons in society. And currently, as a facility resident, I know personally, and I also know collectively, that the fiscal budget is being wasted, I believe, by mismanagement, fraud, and corruption. Thank you.
Thank you all very much. Okay, now we're heading to Zoom for the next panel. We'll start with Sierra Kraft.
You may begin.
Hi, good afternoon, Chair Brennan and Deputy Speaker Ayala and members of the Committees on Finance and General Welfare. Thank you for inviting testimony. My name is Sierra Kraft, and I'm the Executive Director of the iCare Coalition, a citywide network of legal service providers that for over a decade have ensured unaccompanied immigrant children in New York City have access to free, high-quality legal representation. This year, we're in a moment of urgent crisis. On March 21st, the federal government abruptly terminated the Unaccompanied Children Program contract, wiping out nearly $14 million in funding for legal service providers, and 1,300 children lost their attorney overnight. These are kids, some as young as toddlers, who have fled violence, trafficking, and family separation, only to face a complex immigration system without legal representation. And access to legal representation is a key form of homelessness prevention, ensuring that immigrant children can secure lawful status and remain safely with family or sponsors, rather than falling into systems of instability. Without an attorney, a child's chance of staying safely in the US drops to less than 15%. And with an iCare attorney, that chance rises to over 90%. This federal funding collapse is having a devastating ripple effect and is destabilizing our legal ecosystem that we've built over the last decade. Several of our legal service providers have had to do layoffs, freeze their intakes, and lose expert attorneys. These attorneys and organizations have built trusted, culturally responsive relationships with families and communities we serve, particularly in Brooklyn, Queens, and the Bronx, where most unaccompanied children live in New York City. Meanwhile, children are still being scheduled for hearings, their cases are moving forward expeditiously, not understanding their rights, no voice in court, and no protection. The City Council's longstanding support through the Unaccompanied Minors and Families Initiative has been essential, but funding has remained stagnant for more than 6 years, and while UMFI has helped providers shift some of the cases and respond quickly, it's just not enough to meet the growing need or offset the damage
Time
that these federal
expired.
cuts.
Thank you.
This is why we're requesting $6.3 million in discretionary funding to help stabilize UMFI and $5.4 million in emergency funding to help shield us from this federal termination of the UCP contract. Happy to answer any questions, and thank you for your time and continued commitment to the immigrant youth in our city.
Thank you, Sierra. Now we have Carlin Cohen.
You may begin.
Good afternoon, Chair Brannon, Chair Ayala, and members of the council. Thank you so much for the opportunity to testify today and for your tireless work on these important issues. I'm the Chief Policy and Public Affairs Officer at CPC, the Chinese American Planning Council. I want to uplift the messaging that many of my colleagues have already offered, from the deep need for funding for SNAP, to fair fares, to housing support, and others. And while that's all outlined in my full testimony, today I simply want to share with you a story about one of our community members. This particular community member we had been working to support out of a domestic violence situation, got her placed in a domestic violence shelter, and through the process of the move, she came into us because she had been unable to feed her young children, but she was scared of going on SNAP benefits because even though she was eligible, she was worried about how it might impact her immigration status. We were able to, of course, immediately get her food to meet the short-term needs and then work with her to get her enrolled in benefits. But this is just one example of what we've been seeing in our community members. At the same time as there are increased fears about being on public benefits like SNAP, like Medicaid and others, we're also seeing a hugely increased need for it. And we're also seeing under-enrollment in our communities. Only 28% of eligible Asian households are enrolled in SNAP, which is a life-saving resource. All of that is to say, it is more important than ever that the city fund these very important programs because they are so closely related. They're all necessary to support the community member I told you about and our other community members as well. And I would be remiss if I didn't use my last few seconds to mention that making sure that the human services workers that provide these important services are fully paid through Just Pay for Human Services, and that we ensure that the contracts are delivered on time and fully meet costs. Thank you again for your time and your advocacy.
Thank you, Carlin. Okay, now we have Pernell Bryce.
You may begin.
Our Purnell dropped off. Now we have Christopher Leon Johnson.
You may begin.
Yeah, hello. Can you hear me?
Yeah.
Hello. Hello, chairs. Chairs Brandon, chairs Bank, and chairs Bank and Brandon and Ayala. My name is Christopher Leon Johnson and Gail Brewer. My name is Christopher Leon Johnson, and I'm supporting 32 BJ. As on the record, I was a former shop steward with 32 BJ for the MTA Eastside Access, and I used to work for Help USA in 2016 as a supervisor for Help USA at the Howard Avenue shelter location. So I'm here to support their initiative to be reimbursed $90 million into DHS so these guards can get paid back. Not only that, I am calling on you, the finance chair, Justin Brandon. I know you're running for controller. You need to put an initiative with the help of 32 BJ to help out guards with legal help when they get accused by a shelter resident of any violation, because what goes on in these shelters with these guards, and I used to be a guard for 32 BJ as a shop steward, and I know the stuff that I've been in these offices, is that when a guard get accused of anything by a shelter resident, DHS and HRA has to log in those complaints. And what happened with those guards is that they get removed from the job site, and sometimes they might get fired on a false allegation. So I'm calling on you, Mr. Brandon, because you got endorsed by 32 BJ for controller, to put at least $100 million into legal help into these guards. So when they ever get accused of a violation from a shelter client, they are able to really defend themselves with real legal representation other than union representation, because the union representation is really weak. Union representation is really weak. They need real lawyers. When it comes to the other unions like the PBA, SBA, when they get accused of a crime by a civilian, especially a corrupt civilian, like a criminal civilian, they have powerful attorneys to protect these PBA officers. So I'm calling on you as the finance chair and our so-called, hopefully our next controller, to really put real financial incentives to really help out these guards.
Thank you, Christopher. Time has expired.
Wait, I know. Wait, 32 BJ, when they get in trouble with these shelter clients, because a lot of these shelter clients, a lot of them are really corrupt, they're really dirty, they're really evil people, and they really mischievous. They try to find a way to get out the shelter, and they know the legal get around by let's accuse a guard of like sexual assault, or accuse a guard of looking at them funny. Because I replaced a guard that, as a supervisor, that got accused of looking at a girl funny. Okay. But
thank you very much.
That shouldn't be happening. But thank you so much. Thank you.
Thank you, Christopher.
Thank you.
Okay.
Wait.
We've reached the end of the hearing. If there is anyone here who wishes to testify, come on up, sir. You'll be the last one. Sorry. Garland Roberts.
You only got 3 minutes, right?
You got 2 minutes. You made it just in time.
Former Assistant Secretary of Defense, George Herbert Walker Bush Sr. Also,
You can take a sec, get your breath, and go ahead.
I'm mad as Hades. You're getting a budget when you're being drained by people that are stealing from the situation. I went to Commissioner Park and others on the situations because I helped found restoration with Robert Kennedy, and I'm involved with trying to deal with different tenants. And I find that on the succession rights and everything else, when they go to get the HUD monies to pay these type of things, instead of charging the rents, because when you have a Section 8 apartment and you're on a succession or rent control, you cannot charge market value. They're charging market value. The people have complained, and the agencies, parks, and other these people are not dealing on it. I have a person right now, the Department of Justice, and also Department of Investigation, and also DHCR is trying to get through the system. We need a system like the IRS has of a whistleblower system, or else we have to go to Doge and Donald Trump and all these crazies. They're bugging us to give them information, but we can do it for ourselves. We need a whistleblower system that has rewards on conviction, and this way we can have an independent group of people that can try to help and protect ourselves.
Thank you very much. Thank you.
I've been undercover for FBI. I've been undercover for Terragiano secretly in clearing up the bidding process and other things. But this new administration's, you can't get anything done.
Thank you very much.
People on the tape.
Okay, if we have inadvertently missed anyone that is registered to testify today, either here in person or on Zoom, and you've yet to be called, please let us know now. Use the Zoom hand function, and you'll be called in the order that your hand has been raised. Seeing no one, day 5 of executive budget hearings for FY26 has been adjourned. Thank you.